to welcome everybody and call this meeting to order. Would you please call the roll?
See, Raman is virtual. Lon,
Here.
Howell, Cavell. Oh, is she on there?
Yep, she's on.
I'm virtual.
No Cavell. Charles.
Present.
No Whitebird is on his way. Markham.
I'm here and
Gershenson.
Gershenson sitting in as well. All right, if everybody would please stand and join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so with that, we're gonna move right into our budget presentations. Each one is set to be 40 minutes, and that will allow for your presentation and then also questions from the commissioners. I am really gonna try to stick to the schedule because the group that's fourth today wants to be on time too. So you're lucky that you get to be the first day and have it out of the way. And let's see, we also, this time, we're doing something a little bit different, and that is, I think there's a much more collaborative discussions that took place before this between fiscal services and the departments. And I see Cheryl's nodding her head that that's what we tried to do. So hopefully that fleshed out a lot of things earlier, and we'll make this go even that much smoother. So do you have anything you want to add?
No, I think Cheryl had something just to introduce the presentation.
Yeah,
Other than that, we're ready to go.
I'm just gonna take a couple minutes because I don't wanna put everybody behind, but based on exactly what Chairwoman Markham said, you know, we did a collaborative effort and tried to streamline what the board wanted to see. You know, from fiscal services, you'll see we've been trying to streamline and make things on time. The budget book is a little smaller, the ECFR was done on time this year, and so we're really striving to make this cohesive. You can see by all the people in the room that we are making this a collaborative effort. My entire budget team who represents the departments that are here. The departments were encouraged to bring their staff along with them, so we should be able to answer most questions. If we can't, we will get the answer back to you. You know, we kind of, I don't wanna say we threw it together, but you know, every department was provided with 5 specific slides, and then they were encouraged to add what they wanted to add and what they wanted to communicate with you. Each department got their questions that I got from you guys. So, you know, without further ado, I believe Public Services is up first.
Yep.
And while public services is coming up, I will just remind everyone in the room, we've also opened up the auditorium and put this meeting on in there. So if you have other staff members that are joining, I know we are kind of under construction in the kind of tight quarters here, so you're welcome to hang out in the auditorium until your presentation is, it's time for your presentation. Or you can hang out in here as well, but just want to give you the option.
Great idea.
And the page numbers?
Okay, so public services in the big book is gonna be page 218, and in the categorical, it's page 55.
55?
55, yep.
Madam Chair, you are stealing the thunder.
I'll go ahead.
I did my homework.
You know, I have an opening in the budget team if you'd like.
Yeah, I might do that. Yes, I'm doing this right now.
Oh, man. Okay, so if you would introduce yourselves and tell us about your department.
So yes, hi, I'm Madiha Tariq. I'm the Deputy County Executive overseeing public services and health and human services. Before my team got started, I just wanted to give you a little bit of framing, just so that you can see how we answered the questions that were posed to us. Last year, when I began the discussions that Leanne, myself, and Barb, as well as our teams had, was what is the common ground by which we move forward? How do we integrate and grow our services so that we can provide provide for a thriving community in Oakland County residents? And there's 3 things that we focus on, 3 themes that I want you all to think about. One is we want to collectively work to improve the experience of Oakland County residents. experiences they have with us as a county, experiences that they have with our partners. The second thing is we want to work collectively to help demystify the county and the system to all residents of this county. And this again requires, work that we do in being, a better service provider, but also how we collaborate with the partner. And then the third thing is we want to be able to build the capacity of not only our team, but also our partners to be able to reach the hard-to-reach populations and be able to provide services that reflect good user experience and help demystify the county. So these are the themes, but these are our North Stars that we've all worked towards. And we know that having this North Star has really helped frame every question we ask ourselves. So with that, I'm gonna hand it over to the very capable hands of Barb.
Thanks, good afternoon. Barb Henke, Director of Public Services. As you know, Public Services is actually made up of 4 very different and distinct divisions, and I have 3 of the managers with me here today. Kaz Mayarka from the Medical Examiner's Office, Heather Calcaterra from Children's Village, Bob Gatt from the Animal Shelter, and Eric Schmidt is at a state board meeting where they're giving us $2.2 million, so I thought it was more important for me to attend that. Community corrections, I'm sorry, thank you. So, I mean, honestly, I am going to try to whip through this as quickly as I can. I could give a 40-minute presentation for each of these divisions because they are also varied and distinct. So really, this is just to hit some of the highlights. And I guess I'm running, this is gonna be odd, like, I'm hoping it's changing behind me.
Yes.
You want me to
Yeah.
use that?
No, it's fine. So these are our department revenues, and you may notice right on the left there was a huge increase from 20 to 21, and that is when Children's Village was moved from public health under public services, and their whole budget came with us, and so that accounts for that very large increase. There's a couple of other increases, particularly in 2024, in our amended budget for our revenue, and that was largely due to, number one, we took on an unexpected contract with Macomb County to provide autopsies through the Medical Examiner's Office. Meaning Macomb County terminated their contract with Dr. Spitz, and they needed someone to take on those services, so that was almost $600,000 of revenue. And the $1 million ARPA allocation that came to public services from the board, thank you, to do some work around the juvenile justice reforms, and we'll talk a little bit more about them. What you will notice is going into 25, the revenue has dipped a little bit, and that is largely due to a reduction in our animal licensing fees. As you may know, because we've been here a couple of different times about the animal shelter, our license sales are not what they were pre-COVID. We normally would have a large census team, particularly of college students that would go out in the summer, go door to door, try to sell license. That had to stop over COVID, and we just have not been able to regain momentum on that. Even though we've done very serious recruiting, we've increased the wage, we've given signing bonuses, we had 3 people apply this year.
Oh, wow.
So we could keep pretending that we can make that revenue, or we can say, to be realistic, we're not gonna get that. We have several ideas that we're working to increase that. But once we get them in place, then we can always do an amendment to the revenue with something that is more realistic. As you can see from this slide, the department revenues are largely from charges for services. Again, from things like cremation permits, animal adoptions, payments that we get from the state to take care of residents at Children's Village. We have a very small federal grant budget, and that's the school lunch program at Children's Village. Basically, you can see that we have always done very well as a department in coming in under or favorably in our budget. We've always stayed within our budget, and we expect that to remain the same. Even though we've decreased some of our revenues, we've also decreased our expenditures. to match that, particularly because our Children's Village census is much lower than it's ever been, and I'll talk about that a little bit. So with less kids, in some areas, we have less costs. You'll note here that our biggest portion of our expenditures is our personnel, and that's true across all 4 divisions. And that's largely because our 4 divisions are all required in-person work. If someone calls in, we can't not have someone on the floor at Children's Village. We have to fill that. If, we have something at Children's Village or at Animal Shelter, the dogs and cats still need to be fed, watered, and cared for. And of course, the same at the medical examiner's office. So our personnel is a large portion of our expenditures. Now this slide about our personnel and vacancies. We have had several vacancies in '24 and as of right now projected for '25. However, in this budget, we have several of the divisions have requested to consolidate vacant PT&E positions to create a full-time position. So those vacancies will be significantly decreased in '25 if those requests are granted. And we're also leaving some of those positions, particularly in Children's Village, because of the legislative mandates that came down on juvenile justice. We're not really sure what this sort of '25 will be sort of a transition year. Moving into more community-based services, we don't know how that's going to affect the population at Children's Village. So it's sort of a wait and see. So there was a few discussion points that were sent over by the board for us to discuss, and I'm gonna talk briefly about each division. I will say though that there was the question that we received that was about specific examples of how the budget would, specific examples about tasers and body armor. I don't think that was a question that was meant to be posed for us, so I sort of kind of improvised and sort of made one up on our own. So this budget will allow us to improve and maintain service levels over at the animal shelter. We are requesting, again, to consolidate some vacant positions so that we can create a full-time vet tech, and also to increase, there's 2 part-time doctors that we have that were not funded at a full 1,000 hours. And so we're asking that those 2 positions be able to be funded at a full 1,000 hours. And there's also a request for an increase to our food and medical supplies. We have a significant number of animals at the shelter. We are full. And this shelter is much larger than the previous shelter. And if you have an animal, if you bought food, you know that food costs and veterinary care has significantly increased. In fact, at the end of June, we had 178 dogs and 233 cats. Not all of them were at the shelter, but some were in foster, but those were the numbers that we were responsible for. In order to, what Medea talked about, demystifying the county and providing the user experience, some of the things that we have been able to do is we are now open 2 nights a week in the evenings until 7, Tuesdays and Thursdays, and also on Saturdays, because that is when families and individuals are available to adopt animals. So we did that. We also have held 44 vaccination clinics in an attempt to sell more license. On Tuesdays, we started providing, if you came to the shelter and bought a license, you got a free rabies shot. It was so successful that we were doing it every Tuesday. And through that, we provided 1,472 shots. So that does improve the safety and the health of the residents and the animals that we serve. So you can see from this slide that the number of animals that we take into the shelter continues to rise. We are working on several solutions to that, including potentially feral cat colonies. But we just, no matter what we do, because we are a no reject shelter, every animal that comes to the shelter we have to accept regardless of the breed, regardless of the health, regardless of the condition. And so we just continue to to get more and more animals. Particularly the cat population has significantly risen over the past several years. Despite this, we continue to maintain a live release rate that's well over 80%, even though we've had a few dips. This chart is a little deceiving because it starts at 75%. It's not 0 to 100. And so even though we're not always meeting our target of 90%, we are well above, the 80 to 85% live release rate for the animals that we serve. And then this slide, the number of animals that are spayed or neutered. A few years back, we started the TNR program, the Trap, Neuter, and Release. And it has been very successful, and it's sort of a double-edged sword. Because it's been very successful, it means the vets are doing many more spays and neuters of particularly of the cats. To go back to the clinics, our vaccination clinics, in Michigan, the law says that only a veterinarian can administer a rabies shot. And so we need more time for them to be able to provide those shots, but also, conduct these surgeries to make sure that the animals are spayed or neutered. Moving on to Children's Village. We want to improve our service to the residents. With the staffing that we have, we are often able now to exceed the required ratio of licensing to meet our licensing or our contractual requirements. And we feel that this is necessary in order to keep the residents and the staff safe. So while the ratio is maybe 1 to
1-6?
That's what we're doing.
Or 1-8?
So we're exceeding those ratios because the individuals that are coming into Children's Village, and I'm sure you've heard this from the jail as well, are much more significant mental health and behavioral health issues, and they require this sort of supervision. And really, this allocation allows us to continue all of the great services and programs that we offer all the residents at Children's Village, including case management services. We have treatment clinicians on staff, and I'll show you a particular story in a minute. We've also, as Medea has indicated, we've incorporated this model called TTS, and it really helps us to work with the residents to provide and plan for a future, which many of them have never thought about previously. We're also, this fall and over this fiscal and next fiscal year, doing a major training on trauma responsive training for the entire campus. And that will be literally anyone that comes into Children's Village. So I will be attending the training as well as the manager, all the way down to our cleaning staff and kitchen staff, because you never know who may come into contact with one of the residents. And then again, the ARPA allocation that is really going to help us be more intentional and establish some of our long-term and short-term needs. I know Commissioner Gershenson, you were recently over at Children's Village and inside some of the buildings, which all were built in the early 70s. We really want to be better about decreasing trauma and things that we can do to promote healing and wellness for not only the residents, but for the staff at Children's Village. And that's what one of the RFPs was about, is looking at the campus. How can we rework our campus and use it better to promote that healing and wellness? What's not on here is the very great work that Children's Village has been doing on organizational and culture change. We've convened a employee work group who have come up with a new mission, vision, and value statement, and we'll be rolling that out shortly. They've been very involved with creating a strategic plan around that mission and values statement. Because we know that without a healthy workforce, we're not gonna have healthy residents. And so this is a gentleman that was spent just about a year at Children's Village. His name is Abidi, and he goes by AB. He is 18 years old, and he had consented for us to use these photos. But AB, again, was spent about over a year at Children's Village, and he came in as a very angry and traumatized, troubled young man with some pretty significant charges. Over that year, the entire staff at Children's Village really worked with him. He started, sort of the light bulb went off for him. Over Christmas vacation, he worked really hard to recover all the credits that he had missed in high school. And in spring, Waterford Schools said that he had met the requirements to graduate. These pictures are outside our Children's Village School. That's with the principal, Dr. Lake. They sent over a photographer and the cap and gown, and that smile, I think, on AB's face, says it all. He has since been placed into an independent living and is doing really well. So that's really what it's all about, is that transformation that happens with these residents. We have talked in the past about the disparities that we see at Children's Village, and so I just wanted to touch on that briefly. Our overall population continues to decrease. In fact, Heather said as of today, we have 60 residents total on campus. There, in years past, it used to be 200 residents, and so not only Children's Village, but our work with the court, we've been very mindful and intentional about reducing those numbers. And then on the right are the numbers that are just for detention. And while the detention numbers continue to decrease, in fact, it's decreased about 11% since 2002, we still have a lot of work to do. There is still a disparity gap. We tend to incarcerate more Black and brown youth, particularly considering Black and brown youth only make about 14% of the general population, but actually are well over 40% of the population at Children's Village. In community corrections, again, we're asking for a consolidation of some positions in order to create a full-time position in our supervision program. And this is to address the 47% increase that we have seen in that unit over the last couple of years. Bail reform is fantastic, and judges are releasing many more people, but they're also putting many more of those people onto our supervision. And our job is to help them with supports and services and to remove barriers, as Medea had indicated, demystify the county and how they can be successful. We really are moving from, in this particular program in community corrections, moving from monitoring for failure to promoting success. We don't want to just be about, you failed a drug test, gotcha. It's more like, okay, let's talk about that. What are the services and supports that you need in order to make you successful? Again, we're also at Community Corrections working to incorporate TTS. We're doing a lot of work with the health department and trying to coordinate resources that folks might need. And we also have an allocation to provide misdemeanors because they are not covered under our state grant, who are underinsured or uninsured with treatment options, or if their private provider won't allow for that. And so we are helping those individuals and those residents. And that really shows in our supervision appearance rate. So this is the percentage of individuals who come to all their scheduled court appearances. And as you can see, the average is about 92%. So we do very well, people under our supervision, making sure that they get back to court so that they don't incur additional warrants or show cause hearings. Our safety rate, this is one, even though it's still very high, again, the chart starts at 80%. So on average, about 85% of individuals remain arrest-free while they're on our supervision. But we think adding this additional person to that unit so that we can bring the caseloads down will allow us more opportunity to, specifically hone in on those who need additional behavioral health or other services that will keep them from being rearrested. I do have a specific example. It just came up recently. An individual that was in one of our programs came in on a felony drunk driving, which means it's at least his third, probably more, than that. He came in on a VAC of 0.27, which is 3 times the legal limit. He recently just left a voicemail for his caseworker and said that he's doing really well and wanted to thank her. And he had, one of the things that he was planning for his future was his daughter's graduation party, and he was able to go with that without being triggered because he used the tools that he had learned in the program to manage that space. So that was, for us, a real success story. And lastly, I talk a little bit about the medical examiner's office. Again, we're asking for an increase in medical and laboratory supplies because there has been such an increase, and for transportation services. Not to be flippant, but the bodies don't get to the ME's office by themselves, so we have to hire a transportation service to bring them. And we're doing more autopsies, and so we have increased costs there. It's also, we asked for some upgrades to our technology and equipment. Through that, we're replacing some cameras, which will be, our cameras, I think some of them are like 20 years old. And in order to be able to supply quality evidence in those high profile cases, we need to have that. And some upgrades to technology, which allowed us to streamline our referrals to Gift of Life, which was an agreement that you passed just earlier this year. And I'm happy to report that based on that transfer, we've already had 337 referrals to Gift of Life, which resulted, it seems like a small number, in 6 donors, but really that's huge because that's literally hundreds of people that can be helped from just those 6 donors. And then this is just to show the rise in the autopsies. We saw a 19% increase from 22 to 23, and already this year compared to last year, we're 4% ahead of the autopsies that we had last year. So we are seeing an increase in autopsies. And then this last slide is not something I really talk about a lot, but it is something that we are seeing is becoming a disturbing trend. And we would not have known really, it been called to our attention had we not had this KPI. But we try to get all of our decedents released within 72 hours, and we're seeing a disturbing trend that bodies are not being claimed. And we are already at how, 90?
We had 90 last year, we're already at 54 this year.
Because of, we believe, the burial costs, people cannot afford funerals. And it's a significant amount of time and paperwork on the medical examiner's office with MDHS to get that done. But we are working with Garth Wooten of Veterans Services, so any unclaimed bodies that are veterans will be taken to Great Lakes Cemetery for proper burial. So try to live through it, so there you go.
You're doing good. Wow. Thank you very much. All right, I will turn it over to the commission at this point. If you folks have questions, I will start with Commissioner Gershenson, followed by Commissioner Charles.
Thank you. And Barb, we're so lucky to have you overseeing these departments because of your depth of knowledge and personal compassion. Very much appreciated. When you talked about positions, unfilled positions being filled, and then you also mentioned that the ratio in Children's Village is good right now. So do you need those positions to be filled?
Well, so it's sort of, we're not sure. So the juvenile justice legislation is moving towards community-based. They want to keep, as many kids out of detention out of the system as they can. So we don't know what that means for us. One of the RFPs through the ARPA money that we're looking at is, do we do a community-based program on Children's Village campus? Do we do a restorative justice center? So we don't know if we'll need those positions in the future. So right now, again, we don't know if the trend from COVID where we went really low is going to continue, or how the, juvenile legislation is gonna play out. We have begun using what's called a juvenile detention screening tool in conjunction with the court, and that has lowered the census as well. But we're just not sure. I know that's not a great answer, but
Okay, well,
it's sort of a
that's
wait
good.
and see.
Yeah. And then I just wanted to comment, I'm delighted or really happy to hear that Children's Village is doing this mission statement. And I think that's really important, and I might suggest when you do that presentation, maybe you invite the commissioners to come to Children's Village and you do it there. We used to, back in the day, go to different departments. But that has to be okay all the way up the line, but.
Yes, we really wanna get that out to as many individuals as we can. We're right now going through sort of like this feedback stage from other departments, providing input on the statements. Because we really are trying to change the narrative at Children's Village. When we talk to people, it's, and you all may have stories, I know, I grew up in Detroit and it was always like, oh, if, my mom would joke, if you're bad, we're gonna send you to Vista Maria. And it's like, and I'm sure the same thing in Oakland County for Children's Village, right? Like, that's where all the bad kids go. They're not bad kids. They're traumatized kids. They're kids who need supports and services. And so we're really trying to change that narrative, but it starts with the mission and the culture of the employees that we have.
And it's so important, I mean, these are kids, and I encourage everyone to go over there, but these are kids that really need a helping hand, and they're great kids, so
Like AB,
that's important.
right?
that
He just needed
we
someone
try
to
to
really.
change the
Yes.
perception.
Right.
Thank you, Commissioner
Thank you.
Charles.
Yeah, thank you for your presentation. A few things from me. First off, since we were last at budget hearing, some of the commissioners, I believe it was me and Mr. Wiper, got a chance to view 2 autopsies. I survived and I haven't had nightmares or anything. But it was certainly a one-in-a-lifetime, eye-opening experience. I could go on, but one of the things that was mentioned was just finding autopsy professionals, I forget what they're actually called, in that space, and how certain places in the USA can pay more than we can here at the county, and just, I mean, to your point earlier about not being able to work from home, that is definitely a job where you gotta come in and, do people wanna go in the office anymore? So just wanted to highlight that. Also, Medea was kind enough to invite me to lunch, I think it was last year now, and gave me an interior look at all of the many numerous systems and operational flows that take place at Children's Village. So I do appreciate that. I also appreciate the significant dip that I saw in your PowerPoint from Black young people just as recently as August of last year to, just this past month. So that's, I appreciate whatever work that you guys are doing there. I guess my question is possibly more so for Cheryl, but, oh, there you are, wearing green, I love it. Which is on page 218, there's, it talks about expenditures and revenue. Well, it starts with revenue and then it goes to expenditure. But then it's another segment of revenues and expenditures, and I tried to determine what the difference was. One heading had a division of public service administration. So it was kind of hard to tell what the animal shelter versus community corrections. Are you able to see that at your level?
If you keep flipping, you'll
Yeah.
see them.
Okay.
Barb, do you want me to?
Yeah, that's fine. I mean, like each of the divisions is broken out, but you have to look up in the top right-hand corner at the small print. So there's Public Services Administration, and then it goes into Community Corrections, starts on page 223.
Okay.
And then that's all public services, and then the ME's office starts at 225. And the beginning is just like all of the divisions together.
So then, this 74, for example, under fringe benefits, just as an example, that's $74.
What
On page 222, these are all dollar amounts, because when it said salaries, it looked kind of low. So I just wanted to make sure I wasn't missing something. On 2222, for personnel, it's unaudited actuals of 92,749. That's a dollar amount?
That's a dollar amount, and those unaudited actuals are not for the full year. We neglected to put the time frame on that, so I apologize. But that's not for the full year.
Okay, because I was like, wow, that's quite a bit lower. So
No, and I noticed it after we had already gone to print.
understandable. So just, because this could help me for the next groups of departments, there's two, on page 218 and then page 222, two sets of expenditures.
Right, so you're gonna see, the way the book is designed, is you're gonna see public services as a whole. That's where you're gonna see, like on page 218,
Okay.
you'll see in the upper left-hand corner, it says department and then fund. So that's everything grouped together.
Okay.
And then behind that, when you get to, for example, page 222, you're gonna see the division listed. So that's the administration part of public services. And then you'll continue to see the division change, but the department, they're all public services.
Great.
And if you take everything behind it and add it together, hopefully, it will add up to, it'll add up to the pages in the front that just has the department in the front. And that's how all departments are put together in the big book.
Great. So clear. Thank you so much.
Thank you. That was probably a really good tutorial early in the process.
Yeah.
Thank you. Anybody else? Commissioner Cavell, I knew you'd have a question.
Crap, I was hoping I'd have more time.
Well, you can. I'll go to Commissioner Wyford
Thank
first.
you. So, the joint operating agreement with McComb, has that been a good thing, or is that, I mean, you seem surprised on how it's turned out. I mean,
So
especially
in
dollar-wise.
the spirit of, regional cooperation and as, Commissioner Charles pointed out, it's very hard to find forensic pathologists, and we knew that they were going to have a difficult time. So we agreed to provide the service to them. They have hired a chief pathologist, but they only have one. So we are still doing 1 week a month in helping to provide some relief to them. But I will say, while it's brought in a lot of revenue, it has been a strain on the staff, and we've been unable to move forward with some of the other initiatives that we wanted, to take on. And so we are looking, we have some meetings coming up with McComb to, formalize an exit plan with that project.
When it came through, it seemed like it was promising and hasn't great.
Oh, well, I mean, we've done a lot of work, and we've charged them a lot of money, so it was, for that reason, it was good, but it's not something that really we can sustain under a contract like this. If there were plans to regionalize, which I don't think McComb would ever do, but that might be a whole different discussion, but.
And then I did see when you talked about animal control, we lost the 20 animal census workers, and that seems like it's a result of COVID and the changing culture of.
It really is. We just cannot get the workforce, and again, we could keep pretending like that's, or we can take it head on and try to come up with innovative solutions and make sure that the revenue is realistic. And then as we grow those ideas, we can amend the revenue.
And then in Children's Village, we're eliminating some positions and creating a couple and getting rid of some PT&E hours and increasing. If we're at just 60, right? If we were at 200, that's a whole different world, right? You got a whole complex just for 60 people, residents. I mean, you're talking staff, you're talking space, you're talking, right?
Yes.
And you're used to 200.
Well, it hasn't been 200 in a while, but that is why one of the RFPs that we contracted for through the ARPA allocation is for an agency, and I actually have a call with them to start tomorrow, to come and look at the Children's Village campus. How do we have a couple of buildings that have been shuttered for years. How do we reinvent those buildings? How do we use them differently? Even the outdoor spaces, how do we make the entire physical plant be more trauma responsive and informed? And again, while the census is lower, it used to be, we'd have a ratio of 1 to 10 or, 16 kids at night. We have lowered those ratios for our own, through our own sort of efforts. I'm sure you have all seen the news reports of other detention facilities that have been on the news and the issues that some of them have had. And we are doing our best to make sure that never happens here.
I'm glad you're planning for and thinking how this is gonna go long run.
And we're having someone help us do that
Okay.
thinking, yes, absolutely.
Yeah, Commissioner Viper, just wanna say I wanna elevate what she said at the beginning. The needs are have grown, that we have less kids, but the needs for those kids are very, very intense. So that's why, we just don't wanna be in a situation where we end up in the news because something went wrong and we really, or like a kid is harmed. I mean, that's the worst thing, right? So that's why that staff right now, that's what they're focused on until we figure out where the legislation leads us. So.
Thank you. Then we can go?
Is that it?
No.
Well, we have just a couple of minutes left, and I know
okay.
Commissioner Cavell has a question, and also Commissioner Rahman has a question, so. Go ahead, Commissioner Cavell.
Oh, okay, well, just to what you were saying, Phil, about the Children's Village. Yolanda kind of touched on the racial disparity, but just to clarify, there were 200 people years ago, but now there's 60. But what I understand from the staffing needs and the analysis you're doing using ARPA to get this holistic review, one, it's not just Children's Village, it's the whole criminal justice system being mapped for people under the age of 18, because there's the reason people come to Children's Village, which is part of the racial disparity, is because of referrals or police or schools. So that's just one like cultural thing to note, I think, right?
There's actually 3 different RFPs,
Okay.
but they were designed to hit on all of those things, yes.
Broadly enough, okay. But the one thing that I just want to lift up for Children's Village is I appreciate that you're having, if you will, an awareness that what you want is a quality of service, because thanks to those juvenile reforms, those 60 people that are there do need a higher level of care because state reforms and the what did you call it, the like court, there's like an analysis to see whether or not people need to go to Children's Village or can be diverted.
The detention, there's several screening tools that are being required, yes.
So that screening sounds very important because then you're sending the people that actually need to be in Children's Village there, which means there's a higher level of need, a higher level of service because you have people with huge issues instead of people that just kind of shoplifted and then got caught up in something. It's people that have serious mental or emotional or social concerns that need to be taken care of. So I appreciate and respect that you have the adequate amount of staff you need, hopefully. Second thing about that is, my question for Children's Village is, there's the 75-25, right? The state child care fund is switching over. Do you see any benefit from, I mean, you kind of touched on it, having community-based programs perhaps at Children's Village that then could, for the county, help us bring in more revenue, because instead of a 50-50 split now, we could have more of a 75-25. Has that analysis happened, or that's part of the mapping, or what are you thinking?
So we have moved, I think it was 4 positions in Children's Village that would qualify our reentry team into the 75% allocation. The rest, again, remains to be seen, and I don't know that we've really done that analysis until we can see, would it be feasible for us to do a community-based program, like a day reporting program on the campus of Children's Village? And then those staff might then qualify for that 75% reimbursement, but we're just beginning to go down that road.
Okay, hearing that, what I just want to lift up for us is I would be encouraged to see that, because I can totally see the return on that investment, not just for the county's like pocketbook, but just for society, that if we put $1 into someone who's 17 who can be pivoted into productive contributing member of society versus waiting 5 years for them to end up at OCJ costing $30,000 a year, that feels awesome, especially if the state's going to give us 75 cents on the dollar back for that. So that sounds very cool. I had a couple just quick questions about revenue.
We're at the end of their time.
Okay.
So,
Okay.
you can ask and they can get back to us.
Okay.
And also I want to give Commissioner Rahman time to ask his question.
Just one then?
Just one.
Okay, so then to slice the rest out, I guess I'll just go to community corrections. You had to consolidate positions, meaning
Yeah.
less positions, but you have a 95% like safety rate. That sounds like a good KPI.
It
You want
is.
more of that. So why do you have
Correct.
less people to help you with that?
Well, the positions that we're consolidating are PT&E positions.
Okay.
And so we're consolidating those into one full-time.
Understood.
Because it's difficult to case manage in a
Understood.
part-time.
Okay, so better.
Better, yes.
Thank you. Great.
Okay, Commissioner Rahman.
All right, thank you. Can you hear me? Can you hear me?
Yes.
Hello?
Can't hear us.
We can hear you. You
Is
can't
the
hear
mic coming
us.
through?
Yes, we hear you.
Okay, all right, thank you. First off, sorry I can't be there. Barb, Medea, thank you so much for the presentation. I do have a few questions. I know we're short on time, so I'll just try to get to the biggest ones here. One question quickly had to do with the animal control licenses. I know we're down almost $600,000 in that department, and that's just reflecting reality of the situation, which I appreciate. Do you know, are we doing anything to sort of maybe get back to where our desired number is, or maybe kind of pre-pandemic? I know we made quite a few changes, in that division last year as it came to staffing, and we, I know, tried to do as much as we could. I just wasn't sure where we're going, or if we have a long-term plan in that department to try to recoup some of those costs.
Yes, thank you, Commissioner, for that question. We actually are working on several ideas, and we would be happy to come back and maybe in a work group with the commissioners, because some of them would involve potentially legislative changes to try to increase those sales.
I had the same question related to what are your plans going forward to address that. So I think I would like to see, a separate discussion of that either in one of our other committees or.
Yeah, because that could take a while, so I think that would probably be most appropriate.
Okay.
Okay.
One more question.
And I was just, yep, and I just quickly wanted to touch too on Children's Village. I'm so glad to hear that numbers are going down. Everything is trending in a favorable direction, which is awesome. The grant funding I know you mentioned was down $50,000 there as a result of that, which it's a mixed thing, right? It's good that our population is decreasing, but it's bad that our funding is also decreasing with it. Is there something we can do to sort of make up for that, or is there any incentive? Because if we're doing the right thing, it almost seems weird that we're penalized in a way, but if that's the reality of the situation, I guess there's not much we can do.
Well, that one particular grant, the $50,000, was in the school lunch program, and so that really isn't penalizing us. It's reimbursement that we got for feeding the kids through the lunch program, and we have less kids, so we don't.
Okay. Okay. All right. Fair enough. Okay. Sounds good. Thank you.
All right, well, we're gonna, if there's nothing else, we're gonna go ahead and close the hearing for public services and switch up to our next group, which is Health and Human Services. I wanna say thank you to Public Services Department. Back up.
Everyone knows healthy food is more expensive than junk
Okay.
food all the time.
True.
From
I
downstairs.
know.
So our next group
You wanna eat healthy, it's expensive.
is
I'm eating healthy, Pop-Tarts
Health and
and
Human
crackers.
Services.
Staying away from you. It's
Oh.
like 2 blocks up. You go to the restaurant. But don't order for you, just grab it.
Oh, health
Okay.
page at 53.
Health and Human Services, it is on page 205 in the big book and page 52 in the categorical.
Good job.
And there's no other comments or questions, we will go ahead and
What
start.
was the categorical?
52?
52,
52.
yeah.
53.
Okay, and Health and Human Services is a huge department and we're gonna try and get them done by 2:30. So.
We're gonna make it easy on you, hopefully.
Okay, hope so. Welcome.
Thank you. So instead of sitting up here alone, I brought some friends with me. And so I don't know if you know everybody, but hello everyone. Leanne Stafford, Director of Health and Human Services, and also the Interim Health Officer now.
Khadijah Walker-Fobbs, the Officer of Neighborhood and Housing Development. Stacy Sledge, the Business Manager for Health and Human Services.
Will hopefully answer all your operations questions and fiscal questions. So, all right, and figure out the presentation. Okay, all right, great. So this first slide here obviously is our revenues, budgets versus the actuals. You heard Barb talk about the 2021 change when we changed divisions in departments for Children's Village and Homeland Security. So at that point, obviously both Homeland and Children's Village fell under Health and Human Services. Homeland moved somewhere else, and then Children's Village stayed with Media's group and our group, so you see a dip there. There also, in the 24 adopted budget here, there was some ARPA appropriation for salaries, which then again was removed in miscellaneous resolution, so that's where you see the large jump in 2024, if you weren't sure about that happening there, so. The next slide is really looking at our adopted revenues, and you can see from our 5-year average, state funds and charges obviously make up the majority of our funding here. We look at about 49% is our state revenue and 38% is our charges. And so you're gonna see too, as we continue through the years, not so much here, is we're really looking for new opportunities for sustainability of our programs, right? So where can we look at opportunities for new revenue, whether it's our food licenses, another thing is vaccines. Up until this point, we really haven't billed for vaccines. We didn't have the capacity to do it, and so we have just started enrolling in being able to bill for vaccines. So you're gonna see some revenue there as well as we start to continue to move through there. The next slide is our, let me make sure I'm in the right, department expenditures. Again, department expenditures and adopted, you can see that, let me make sure I'm on the right one, versus actual, sorry. Children's Village was moved out, and then the 17 million, of course, in the 24. But we received a lot of funding for COVID, so that really exchanged a lot of the funding for salaries, because a lot of that was approved, or we were able to use some of the state grants that we received for COVID. And so you'll see a lot of favorability for us in salaries and fringes in the general fund. And so that's the difference that you'll see here in the expenditure budget versus the actuals. The next one is the 5-year average from 20 to 24, and you can see personnel makes up the majority of our expenditures here. And again, that's our individuals out on the streets, right, really providing the services, really the mandated services that we provide from the state mandates that we have here, so. And you can see about 73% of the budget is personnel and 26% of it is really operating costs. And the next thing is our personnel. So you can see we kind of ebb and flow, right? Currently, we have about 23 general fund positions that are open right now, and we are looking for individuals to fill those. A few of those are nursing positions, so we kind of see this struggle between hospital and public health, right? So sometimes we'll be short a few nurses. A lot of times people went to the hospitals because they were paying more, right? Especially during COVID, they're grabbing nurses because they could pay a premium if you came and worked. But we're starting to see this shift now, so people are starting to shift out of hospitals and wanting to come back to that Monday through Friday, 8:30 to 5 situation. So we have been seeing maybe 2 or 3 applications, right, for each nursing position that we put out. The most recent one, no, this isn't huge. We got 20 people that actually applied, which to us that's a good group of individuals that we'll be able to interview and hopefully bring in. Let's see, let me just make sure I have all my notes here. We actually have 361 total employees if we talk about health and human services, so that would be housing and health. Again, a big part of those are general fund, but even in Khadijah's team, we have about 25, is that right? We keep growing, we went from 21 to 25, so that team is really growing as we start to look at that, so. All right, keep going on that. All right, so then we took your questions, right, and answered those, and then as we go through those, we'll talk about our asks as well for this budget year. So the first question is, how are we going to support ongoing mental health services for Oakland County residents? And so I think Madiha teed this up very well as she started talking about what our guiding light or North Stars are, and that's really asking or helping people understand what the behavioral health system is, right? And so kind of demystifying what it is to people. We both get a lot of calls on a daily basis trying people to understand the system, right? Because you have public and private, community health, mental health services. And so and people struggling to get the assistance that they need. So Madiha and I spend a lot of time working with our OCHN, which you all know, they come here, our other behavioral health practitioners on how we can get people the assistance that they need. So really trying to improve that user experience, right? How do they get into the right door to try to get assistance for themselves, for their family members, for first responders, right? I mean, we've all kind of been through the past few years, many different situations, but how do first responders get the assistance that they need? So trying to make sure that we can help people understand it. We don't provide the services, right? But we can definitely connect people to the right services and make sure they get in the right door. We're also continuing to partner, right? So there were a lot of ARPA grants given out to behavioral health, but now that ARPA money is gone. And so how do we continue to partner with them so they can continue to provide the services that they do now and not see any gaps in the services? And so continue to have those conversations. And most recently, about, 2 years ago, I think it's been, we created this amazing data team, right? So we have an epidemiologist. We have 2 very experienced public health professionals that are very good with surveys and data. And so we're helping our partners bring data to the table so they can see, based on what data is out there, what services we should be providing, gaps in our services in which we should be providing. So that's how we're going to support them. Again, we don't provide the services, right, but we can support them. And one thing that's really missing here is our integrated urgent care, right? So, or what we're going to call it, we haven't quite figured out the name. That is a big support. So as you remember, we received the $5 million from the state of Michigan, and then we also allocated another $1 million. So excited to say we're up and running, right, at this integrated urgent care. It's just been a pilot, right? Just kind of word of mouth on the streets. We haven't done a lot of communication, but at this point we've seen right about 250 clients, and they're all amazed at the services they can provide. They can walk in the door, right, and they receive a complete we call it complete care, right? Holistic care, from primary care to behavioral health. And so there's an assessment done, and then they can be treated by both behavioral health and primary care. So Very soon, we'll be kind of announcing this as a bigger initiative because they'll start the hours will expand, but we also see that as a big way. In-kind cost, right? Mediha's time, my time, Kate Guzman. We're doing a lot of communications help to the partners that are at the table as well. So expect to see more on that coming soon. And so the next thing are what are the key initiatives for addressing public health challenges in the next coming year? And so one of the meetings we came and we were talking about the new lead rules that are coming through. So there's new House bills that basically requires all kids to receive a lead test. Prior to this, it was recommended that all children under the age of 6 receive at least one lead test. Now it's been mandated that providers, as they see kids coming in, they should be, really it's mandated to give a blood test. We expect that the number of elevated blood levels that we'll see in kids will rise significantly. So just by word of mouth and us only seeing about 16% of kids receiving these lead tests, we've done somewhere between like 15 and 20 EBL investigations a year. And so we are expecting that could double or even triple. And so what we want to do is create a lead team that is specifically trained and goes into the homes. We're going to do nurses as well as sanitarians. So nurses serve as our case managers, and then our sanitarians go in to find the source of the lead. And we all know it's not generally the water that's causing the issue, but it could be spices, right, makeup in the home. And so our sanitarians go in and do a very intense investigation across to make sure what is causing that child until we start to see the levels come down. The other thing that we're looking for or asking for is community health workers. And so this has been a model that many people have used, right? Really looking for individuals that are familiar with communities and really engaging directly in those communities. And so what we're looking to do to address the social determinants of health is to bring community health workers in to really dive into those areas and provide those services to those individuals and ensure that people are receiving the referrals and services that they need to receive. The nice piece about that, although we're looking to create those positions, there is a billing model now for community health workers that we'll be able to utilize, that will be able to create sustainability for that, and even be able to hopefully add on to that team as we're able to bill for those. So that is one request that is in the budget. We're also, and I'm not going to kick it to her, but she'll help me talk about this, is really create a housing first approach in public health, right? So prior to, or actually it happened after our budget meeting last year, we made a big change and brought all of Health and Human Services under one roof. So Neighborhood and Housing Development was over in the annex off of Elizabeth Lake. And so we saw it important as we started talking about the importance of health and housing, right? Those social determinants of health, how we can bring them together and work together more. So we brought them under one roof. So it's nice because they sit right in our offices. And so our nursing staff and our environmental health staff can work directly with Khadijah's team. Don't have to pick up a phone, right? They can connect right in the office. And so it's worked very well. You want to add anything to that?
Well, I guess just kind of with the approach and really focusing on reducing homelessness, we're really proud to say that we've reached 4% of our decade-long goal. We had a goal of 11,500 units of affordable housing over the next decade that we're trying to make sure that we can provide in Oakland County. And through the Housing Trust Fund and the different work in the different programs to some of our HUD-funded developments, we have at least signed off and approved 4% of our goals. So we have 513 units just in the last year of affordable housing, and then an additional 647 of mixed income units that have been approved. So, provided that everything goes well and all the groundbreakings are on time, we're really excited that we have hit 4% of that goal just in the last year. So that's one of those key things that are going to help with the housing first and reducing homelessness.
So the next thing we are really focusing on is capturing and sharing success stories. Public health, we have a lot of stories, but you don't hear about them, right? Because we tend to just keep them in and just, kind of pat ourselves on the back, but we really want to start sharing the stories. We want people to be aware that the health division is not just about vaccines and COVID, right? The amazing things that our staff do across the board. And so we really want to start sharing those stories, not only to reduce stigma, but really get people to know, right? Increase the awareness of all the services that we provide at the Health and Human Services, because people are still just learning about housing, right? Because we used to say we're kind of not open for services and housing, and now we're saying, hey, we're open for services in Oakland County. So really starting to tell those stories. And so I think I'll tell a story because Barb told a little story is recently Pontiac, right? City of Pontiac, I think it was Pontiac is who it was, actually gave, who was it?
Housing Commission.
Housing Commission, yes. Gave away a house to a mom and 2 kids, right? And so the day that those keys were given away, one of our team members that have been trained in TTS were there to provide wraparound services to her immediately. So they met with the mom, right? And we talk a lot about, as part of TTS, is what is their dream? What do they see success for themselves, right? And so her struggle was around food. She really needed food for her 2 kids, but also she was struggling with the school system. She was trying to get assistance for her kids in the school system because I'm not exactly sure what it was, but they were struggling with their IEPs, right? And they couldn't get the schools to respond to her. And this nurse was able to meet directly with the school district to try to get this mom help. And so now the hours she had spent just trying to get connected, she could focus on something else, right? So it was hard for her to keep a job because she was spending so much time at the school. So that's just one success story. And so that nurse that's trained in TTS is going to continue to meet with that mom until she gets to the point where she feels like she doesn't need our assistance anymore. And so it's been a great success story, and we expect to see many more as we get those community health workers out into the field. And then partner connectivity. You heard Barb talk a little bit about TTS. There's really not a standard of care around social determinants of health or that social care piece. And so what we're trying to build, starting here at the county through Health and Human Services and Public Services, is a continuum of care or a standard of care for it. And then we have partners that are very interested and actually engaged to start delivering that same standard of care. So when you go to a doctor, right, if you have diabetes, a doctor will treat you based on a standard of care, right? We don't have that for social services. People do it different ways because they maybe don't have all the resources or are not aware of all the services in the community. But what we're trying to create is that standard of care so that all of our partners are using the same language and sharing the same resources to ensure that those people in the community are actually receiving what they need in the community. So it's worked out very well. We've trained about 50 people now and about 7 outside organizations in this TTS model. So expect to hear more for us coming soon, but we really see it growing very quickly and people are very interested in that. So next slide. So proposed budget, how will the proposed budget enhance the delivery of health and human services across the county? So talked a little bit about, we call it the scaffolding of support for mental health. We see a lot of people that come in the door, right, just need maybe some basic mental health services and then some additional services. And so using our community health workers, right, to meet people in their communities. People don't come into our buildings as much anymore, right? They're looking for us to kind of come to them, right? Maybe they're not aware of a service that we provide. I don't know. Maybe they walk in the door and they see a sheriff sitting there and they don't want to come into the building. So our goal is really to get out into the community. We call it outreach. We call it a bunch of things, but really get out where they meet, in libraries, right? Maybe they come to El Centro because they receive services there. We want to be there to be an extension of services in in all of these locations as well. So really looking at that. Again, we talked about the standard of care across the county, right? It would be wonderful if we can continue to build this expansion of services and partners that share in that standard of care, and we're going to continue to do that. We talked about the housing first approach in public health, really bridging that health and human services or health and housing initiatives more and more, right? Khadijah has lead people, right, that do lead inspections. And so how do we mirror them with with the health division side of things as well to ensure they overlap and are looking at all the same things? And then increasing affordable housing options. This board has, allocated money toward the Housing Trust Fund, which has just been amazing, and this A+ team has just taken it and ran with it. So I don't know if you want to talk about.
Yeah, I'll talk a little bit about the blueprint real quickly too, because the blueprint to end homelessness, which I know was, developed in 2021, we've really taken it to the next level this year, and it'll be a focus next year to make sure that we're strategically connecting the health side and also public service side. So it's about 60 stakeholders who convene, every quarter, and we're really measuring actionable items that are getting us to the goal of truly building bridges and making sure that it's not just a meeting to meet, but we're making impacts and changing some policies, we're changing the way that we communicate with each other. And to Leanne's point, really bridging the gaps to make things easier for people. We talked already about some of the developments coming down the pike, but to Leanne's point, also just the fact that we sit together. We are really trying to be strategic as we look at grants or look at ways to work together with the environmental health services team and even the homeless healthcare nurses. We have an initiative that we're doing this week where we're going out to work together because obviously we know people come in for health services, but housing is always at the forefront a lot of times. And so how are we strategic about the integrated urgent care, serving people who have housing needs that come in through that door? So all of those things are going to be heavy focuses for this year.
Great, thank you. And then the last one is really preparing what we expect to be a significant rise in EVLs and kids, and that is that lead team that we're trying to put together. As that's part of the ask here as well. So that was part of our budget ask. And the last thing I just want to add before we get questions, we are having a Health and Human Services Expo, and if you have not received, we sent some information out, but we just want to remind people on Monday, it's the 19th, it's actually in partnership with Parks right behind us and other individuals. It's 10 to 1 at Catalpa Oaks. We would love to see all of you all there. We have over close to 400 people registered. So we had 90 just about a week and a half ago. So.
Cheese.
Yeah.
Cheese and grapes.
Yeah, we need a few more cheese and grapes. No, so we are going to give away, Meyer is giving away bikes and car seats. We're going to have school supplies for people. We have someone that's going to provide haircuts. So that's been a little, we are, which is going to be amazing, right? And we're going to, like I said, school supplies. We're going to have lunch for pizza for people. So it's going to be really exciting. All of you are welcome. So we don't know yet, so I didn't see that.
Yeah.
I didn't get the confirmation from that yet, but maybe. So all right. Questions?
Okay, so I will open it up to the commission for folks who have questions, starting with Commissioner Long.
Thank you. Thank you, Madam Chair. Thank you. That was a great presentation. So just a couple questions. You mentioned that for revenue, generating revenue, that there was going to be a charge for vaccines. So I'm just a little concerned. Aren't they free now? And I'm just a little concerned, will it be a nominal fee? I don't want to cut out are you talking about the childhood immunizations? I don't want to cut out people that come here if they're free and not be able to pay and see a decrease in vaccination. So that's my one question.
You want me to answer that one?
Yes.
Okay, all right, so we have a fee schedule for all vaccines.
Okay.
But if someone is unable to pay, right, we work that through with them, right? So if somebody walks in the door. But what I was referring to, we're just billing insurances. So we haven't billed insurance, like Blue Cross Blue Shield, right?
So you're gonna get back.
Yeah, at this point, we had only billed Medicaid and Medicare, and there were some of the blues that we could. But now we're working with Corp Counsel to enter into agreements so we can be a network and bill for those vaccines.
That's great, because you guys do a wonderful job with the vaccinations at the health department. And then the second question, the lead levels, just a little, it's a mandate, so they will be at the doctor's office only. So how are we gonna catch all the other people that don't go to a doctor every year? 'Cause, I mean,
Great question.
I had 5 kids. I didn't even go every year with mine. So, and I had insurance. So this is people without insurance. How are they gonna catch? What are we gonna do?
Yeah.
Blood tests.
That's a great question. So actually, we're gonna do it in our WIC office.
Okay. Oh, perfect.
So currently, and that's actually a gap. So another piece I probably should add in there is that we may do a finger poke, right? But we don't do a confirmatory. And so we're not paid back, not that we don't go into the homes. We generally don't get reimbursement if we go into a home if we don't get the confirmatory, right? So we've been trying to get parents, and this makes me laugh because as a parent, I have a tendency to not go back, right? If it's not sitting in front of me to get it done, right, I don't get it done. And so I can't imagine somebody that has a struggle with maybe getting transportation back and forth to doctor's appointments. So we're gonna be able to do confirmatory right in WIC. So we'll do a fingerprint and confirmatory right in WIC. That's one of the positions that we asked for as well, so that at that point we can start services immediately. So another thing is our Vaccine for Children's program that are in providers' offices, they're gonna start educational programs as well with the doctors to talk to them about the importance of vaccine, getting the finger prick, if you can get it immediately and get the confirmatory, then we can start services. So we're gonna really start working with providers as well when we're already in the offices talking about vaccines.
Good. I'm glad to hear that it's involved in WIC because it's gonna miss a lot of kids if it's just at a primary doctor. So thank you.
Commissioner Cavell?
Just a couple questions, but quick clarification. You guys, from looking at the slide, your staffing level is going up, down, or staying the same this year?
We have requested an increase in positions, yes. So, yeah, we received additional $1.7 million from the state, and so we are increasing our positions using that money.
Okay, cool. All right.
That's the lead positions, the community health workers.
Right.
And then we're also asking for 2 full-time hearing and vision technicians because we're really struggling recruiting hearing and vision techs part-time. So we're hoping so just historical, they used to be full-time. And then back in 2007, 2006, we switched them to all part-time. We have about 5 vacancies at any time because it's very hard to get people to want part-time. So we're hoping to see a shift in full-time, and if so, we'll start converting some of those positions, hopefully.
Cool. Well, you saying all that, I just wanna, quick little reminder story and then a couple questions. But remember the day when Leanne came to us and the budget, switch ups she wanted were to erase the part-time, which you had reduced and not staffed, but part-time teen suicide prevention position and the part-time, again, which you reduced and did not staff because you knew you'd have to cut something, HIV outreach person. And we talked about it for 30 seconds. And then we gave the sheriff $1 million more for 15 more employees, just for context. So, okay. I still have questions. I just want to let that sit for a minute that that's what we did. So the community health workers, is there a startup cost to them?
There's training that's required, right? So we'll put them through TTS training, but that money, that 1.7 that we received, we've baked that in. So they'll go through a basic training, right? And then, basically a computer and stuff, and then they'll be out offering those services, so.
And then they'll just be reimbursed through Medicaid or something?
There's actually 2 ways we can have them reimbursed, and we're still determining what is the highest level of reimbursement. There is a reimbursement rate you can get for community health workers, so they're working on the reimbursement rate. And then there's Medicaid outreach. And so Medicaid outreach is basically how it works, if you're out providing services to a Medicaid eligible population, you can get reimbursement.
Oh, eligible, so not just,
yeah. And you have to provide certain services.
Sure.
There's 7 different services that you can get, 6 or 7 different services you can get reimbursed for, so.
Is that, that's reimbursed through Medicaid, but then the other way, these are because the state expanded Medicaid or something?
Yeah. Well, Medicaid outreach has been here for a while. The community health worker is new in the state of Michigan that you can get reimbursed for. If you call them a community health worker, they have to have certain credentials, then you can get reimbursed. It's a very nominal fee. You don't get reimbursed a lot, but yeah.
Will there be a gap anticipated in, reimbursement versus cost for salary and benefits? Or so part two is like the scale of the need, is there a need through the county for 20 of these folks, but you're gonna start with 5 and then hopefully grow? And if so, why?
So we have one through a grant that the state gave us, so we just had that approved the last budget cycle. And so we're kind of getting started with that individual and a nurse. We anticipate we probably could have more community health workers, right? One in every area of the county, but we know we need to work on a reimbursement model, right? What does that look like? And so we want to start out small and make sure that they're very intentional in the populations that they're going in and that we're meeting kind of the need of the people, and then we'll look to be able to grow based on, hopefully, the sustainability of the position.
Okay, so there isn't like if just as a caucus priority, like trying to expedite or expand that to meet the needs of people quicker. That's not.
Yeah, I don't think we know that yet, so I think
Okay.
this starting small, right? And even small when you think about a team of 6
Yeah.
is still difficult, right? Because we still want the standard of care, right? We want to make sure they're following the standard of care, that they're connecting with other partners for resources. And so we're kind of starting out small and then we hope to build it larger.
Understood. 2 last quick things.
I want to give Commissioner Powell and Commissioner Rahman each a chance to ask too, because we're having a hard time communicating as to whether they want to ask a question. So let me ask them, and I don't see anybody else besides you that, no, Commissioner Wyford also wants to go. So Commissioner Rahman, do you have a question?
No, actually, I'm good on this one, but thank you. Just keep up the great work, Leanne. I know we had a meeting last week, and you guys are doing phenomenal. So no, nothing from me. Thank you.
And also for me, Commissioner Markham, I'm good too. Thank you so much. Leanne, you're doing a great job.
All right.
And your team, so thank you.
Commissioner Wyford?
And this might be for Cheryl Bryan, but it's come through all of these that we're really addressing increases due to building space cost allocation. And it says, as facilities develops the cost. So we do, that's might not be for you directly, but that's coming through every one of these. And also increases for reserve for insurance fund or.
Yes.
So you're hitting every department with that?
Yep.
And you guys are anticipating that?
And, grants too get hit with that same, and which is why we consolidated into one building, right? We really did try to find a way, because again, a lot of our staff are field staff, right? So we eliminated a lot of assigned desk space to our field staff when we brought neighborhood and housing development over, and just have this kind of collective, as you need to come in, because again, nurses are in homes, right? And they're in South Lyon and, wherever it is. And so we really want to give them the opportunity to be in the homes and not be expected to be sitting at a desk. And same thing for our sanitarians, right? They're in restaurants, right? They're doing well and septic and, they extend their hours, right? They might be there till 6 o'clock in a restaurant because they've been there for a while and sometimes they'll take a few hours. They probably feel that way. I used to do inspections. So, or they might get there at 7, right? To try to beat the rush to make it easier. So we really tried to look at the space that would work best for us in this new kind of virtual world and that we live in, so.
All right, thank you.
Thank you, Commissioner. I just have 2 questions or 2 clarifications, and then I'll throw it back to Commissioner Cavell, who has some more questions. You talked about this integrated ER. Is that in one location, or is that something that you do at different hospitals?
Yeah,
or?
so currently it's one location, right? So we are partnering with Honor Community Health, right, for primary care, and then Oakland Community Health Network as the behavioral health partner. And so we're currently in Honor space, right, in Pontiac at, oh my gosh, I almost said Doctor's Hospital.
General Hospital.
Yeah.
That same
I can't
one?
go back to that, I always go back to that. So that's currently where they're operating,
Okay.
but we're gonna be opening a permanent space location to be announced very soon. And so we'll be moving permanently in that space, hopefully early next year. That's our plan, so.
And then my other was related to the lead team. So all of a sudden, all these parents are gonna find out their kids have elevated lead levels. what's the plan? Is there treatment? Is there education? Do we hand them a bottle of pills and this will
So actually,
fix it?
we wanna figure out what the source is, right? So that's our first step. So that's why a nurse will go in, right, to start kind of the case management. And then based on kind of that first overall look, cause right, they're trained, if they're not sure where it's coming from, right? If they're not, so maybe it's obvious, right? Maybe there's somebody from overseas and maybe it's something that they've recently, come to Oakland County, right? And haven't been tested before or 90% of the time though, a sanitarian will come in to do an investigation, right? To look for it, right? We have some really cool machines that can actually detect whether or not the lead is like right here, right? So we also always do water sampling. It's always part of our investigation. Maybe it's the faucet, right? Maybe it's lead paint, right? Maybe the house was built before 1978 and we know it's lead paint and it's flaking and the nurse can see it, right? So that's where we start. And it's generally identified pretty quickly, right? I mean, because again, they've been trained for quite a while to, they go through a very extensive training to be certified first. And then find those sources. And then of course, we're always gonna work with a physician, right, if it's needed. But generally, we'll start to see those levels come down significantly because the source is easily detected, so.
What I'm thinking about is, we know there are whole neighborhoods, for example, in Pontiac that have lead pipes. And it's gonna take us, I've been told, up to 20 years to replace all those lead service lines. So I'm a mom living in one of those houses and I worry about my kids. That's the whole, I think you're gonna see, if we're gonna start testing everybody, we're gonna start seeing a lot of kids with lead because their house has lead service lines.
Right.
May not be anything else, but.
So it might be a lot of education around bottled water, right? The state has some programs too that provide pitchers of water, right? You remember some of the lead programs that went around? We had a couple of CVTs down in the southern part of Oakland County where we were giving out lead filters, right, or pitchers. So there's programs there. We actually are applying for or have applied. We applied for a grant that's specific for Pontiac that focuses on that.
So you're ahead of the curve here in your thinking.
We knew lead was coming, and lead was coming. We have been talking about lead for a long time. The fact that they apparently put some legislation in place really benefits us because now we can start really talking to people about it. And they tend to listen, right? Because obviously there's something there that's really got their attention, so it's good.
All right, those were my 2 points. Back to Commissioner Cavell for 2 more minutes.
Okay, thanks, man. I just wanted to highlight how if we look on the slides, that the charges that you've received have been flat for the last 4 years at least, which, if you take into account inflation, the cost of time and money and all that, like that's in effect a decrease. Just so when we see those health rates or fee things.
Like saying like the EH fees and stuff?
They not only have stayed flat, but because of the time value of money, they've gone down. So just wanted to make sure we lift that up. I had a question. Okay, wait, one more thing. You said, Khadija, that 4% of the housing goal has been reached. Just doing back of the envelope math with like the number of units we've used the Housing Trust Fund to build, that is like $20,000 to $25,000-ish per unit of attainable housing. Is one way to say that, in like a way that we can understand, right? Instead of just saying we put $20 million in the Housing Trust Fund. Or it's, if Oakland County wants to value attainable and affordable housing, $100,000 would make 4 affordable units for a senior in need or something. Is that a fair-ish?
I think it's a fairish way of looking at it. Because, of attainable, yes, and we have the 647 mixed units, but I think it's a fairish way of looking at things.
So just 20 to 25K for everyone that needs housing. Okay. Question about priorities. You said scaffolding, that's a cool term. Like how much or where in the budget do we see the cost of that, like standard of care, this mental health that seems to be very important for our caucus or the commission? How do we see how much that costs and what are the gaps therein that maybe we could work on filling as a priority for the commissioners and our
You know,
responsibility.
at this point, we've kind of just taken it on, the existing employees have taken on these mental health requests, right? Like,
Okay.
I'm gonna use Kate Guzman, for example, right? She's pulled in 500 different directions. We have put her on the team that's working on integrated urgent care, right? So, the community health workers, right, that is a big push, right, for us to try to get that standard of care out there. We also have 2 other employees that have really just added this TTS piece. You don't know Marcy Wiegers, if she was in the room, I would love her. And Marcy has taken this task, right, and just found time in her day to make sure TTS has started, they've already done 2 trainings. And so Barb, Hanky, and I have taken on a lot of that extra responsibility, right, just to make it happen. We prioritize what's the most important sitting in front of us, and we know this is a very important piece. So we feel like asking for the community health workers is the start of this, right? And so I think we continue to come back, right, and really explain and provide our successes, then I think that will be, maybe your all's opportunity if there's additional positions you want to put toward it or additional funding you want to put toward it. But we thought it was important, this additional 1.7 that we were getting, that we put some significant, funding into it for these purposes. We're also, there's training in there, right? So in the contracted services, there's training dollars in there to make sure that we can continue to train our employees on this across the, and partners, right? To make sure that they're using that same standard of care.
Okay, thank you. Thank you, Chair.
Okay, thank you, Commissioner Cavell. Anybody else? Going once, going twice for Health and Human Services? Thank you very much for coming in today and for your very fine presentation. Easy to understand, lots of good information, so thanks.
Thank you.
We're gonna take an 8-minute break and start up at
My gosh.
2:40. So we are going to move into the Parks and Recreation section of our budget hearings.
Parks and Rec.
Let's see, for.
With that, I yield back the balance.
Oh, yeah, there we go. See, all we needed to do is applaud.
That's right.
So in the categorical, they are on page 79, and in the big book, they are on page, I believe, 314.
Send it in an application.
Okay. With that, if you would please introduce yourselves, and then the floor is yours.
Thank you, Madam Chair. Chris Ward, Director of Oakland County Parks. This is Jim Dunleavy, our Manager of Park Operations and Programs. Aaron Stepp, our Manager of Business Operations and what else? Internal Services. And Kevin Sion is our Fiscal Services Coordinator. These are the people that make me look good every day. Okay, just have to give you the usual overview of who we are and what we do. This is just a bit of a reminder of our physical presence. We are now our 15 county parks with more than 80 miles of trails and 7,000 acres of parkland. I'm sure you're familiar, we have dog parks, water parks, golf courses, nature centers, the county fairgrounds, the farmers market, and our ORV park. We did welcome our latest county park to the park system last year, Pontiac Oaks. And coming up in this next fiscal year, we'll be welcoming Oak Park Woods to our park system. And then beyond that, Southfield Oaks, likely in 2026. You just approved the transfer of the management of property just south of the courthouse here, which will become Bicentennial Oaks. We are currently applying before the MDNR Trust Fund Board for the acquisition of Turtle Woods in the city of Troy. Really beautiful 80-acre area, wetlands and untouched natural beauty in that community. So we're looking
Before
forward.
you go on, Bicentennial Oaks, describe again where that is.
It's just south of us here. It's about 100 acres.
All that green space.
Green space over that way.
Sunflowers.
Sunflower.
Sunflowers come from.
Yeah, it's a really interesting piece of property.
Yeah, okay, I gotcha.
You know, that road behind Harbor.
Didn't know it was a park.
Well, will be. Yeah. As of your last board meeting, I think you approved the transfer of the management of it.
Okay.
It's an interesting piece of property because part of the former Eastern Michigan State Asylum was located on the campus. That way, much of the remains of that, artifacts are still there. So, it's an opportunity to teach a lot of county history. I think that property was originally bought in 1820, so kind of ties into that bicentennial theme. Of course, we had the county's 200th birthday and had all these celebrations planned, and then COVID hit the same month. So it's an opportunity to pick up and celebrate the county history, and we also hope to have some nice ways for people to get active and fit, both county employees and folks that are visiting the county service center as well. So more to come on that.
Appreciate it, sorry to throw you off your.
No problem. Right now, we have about 55% of the county residents within 10 miles of a county park. Our hope is, we do have this millage question on the ballot, and it'll allow us to continue to pursue partnerships and opportunities. We think we can get that number up to 85, 90% in a matter of years if things are successful with the millage. And then we, of course, are more than just our physical presence. We've kind of moved to even greater roles and responsibilities away from what I guess I would call our capitalization, Oakland County Parks, to parks for recreation and conservation in Oakland County in general. And I know many of you are really familiar with our programs. We have great adaptive recreation accessibility programming. If you ever get a chance to get out and see our Disability Dirt Day out at the ORV Park, it's pretty cool. We have special events, the Marshmallow Drop in South Catalpa Oaks. We have plans for a new big event in Waterford this upcoming winter, Fireworks and Flannels, I think is the name of it. And a new summer event I think we have planned in the future as well. We provide a lot of planning assistance to local communities. You're all familiar with the grants that we provide to local communities for capital projects, the natural resources projects that we do as well, invasive species management, restoration of natural areas, et cetera, and our history programs. Of course, our mobile recreation unit as well, which supports 600 to 800 local events every year. And they estimate about 1 million people. We are governed by our Parks and Recreation Commission. We have 2 members here today.
Picture changed.
Yeah, we apparently need to get Chris's picture changed.
I lost a lot of weight and I got more hair. That was after cancer. So
We're a little different than
Yeah.
other county departments in that we work directly for a board that's a mix of elected and appointed officials. They basically take the role of what a countywide elected official would in leading our day-to-day policy direction and budget priorities. I do want to point out one of my managers here, we already introduced Jim, but Jim was recognized with a unique award this last year. The Michigan Parks and Rec Association awards just one person a year their fellowship award for outstanding professional in the field. Don't clap for yourself.
It's the highest achievement you can have.
Yes, it is. Yeah, it's like the Oscars.
Smith Charles was there.
Yeah.
Is there a fellowship?
He's the fellow. Yeah, Jim's dad was a county commissioner as well, just for your interest. Okay, just a couple, we are a bit of an oddity in county government. I like to go over this just to sort of set the tone a bit because we are an enterprise. That's why we're in the back of your budget book, which means we need to be fully financially self-supporting. While we're financially totally self-supporting, we are subject to the decisions that all of you make in your oversight, decisions you make about general salary in positions, various costs that are passed on to us. This is the only situation that I know of that you'll ever see that you will be asked to vote on both sides of a contract. Our law enforcement contract is an example of that. So not only are we sort of part of county government, we're also sort of a customer of county government. I also think we're probably the most accountable department of county government because of not only are we responsible to the Parks and Rec Commission, to all of you, we're also sort of in this retail sales space as well. About 25% of our income comes from sales at our facilities. So we're in that customer service business. And then ultimately, we're the only department that's actually subject to the direct vote of the people to continue our existence on a regular basis. There is a equation that we have to follow in order to remain fiscally healthy, and it is to operate our operating budget with a surplus sufficient enough to replenish the savings that we utilize to maintain and invest in our assets. We are in a good position for where we're at right now. We do have kind of a healthy surplus. Of course, we have some of these greater issues that I'll talk about in a minute in terms of our looming needs to invest in major facilities and major projects. Just in terms of our budget highlights, I do want to note that we have experienced really a surprisingly sustained amount of growth in sales and interest and participation in recreation. I think a lot of us sort of anticipated when the worst of COVID was behind us that might taper off a bit, but we have had a record year once again at our golf courses. The Red Oaks Water Park has been very busy with the heat. Campgrounds are very busy as well. So we see nothing but just a growing trend of interest and participation in recreation in general that looks to be continuing into the future. Our ARPA plans, which I'll talk about a little bit later, is a big focus of our attention. Part of the 2020 millage campaign was about catching up to more than $20 million in deferred maintenance projects. We're on track there. We've got more than half of those projects either completed or scheduled. We have also had a great success story. We always want to thank our friends in Human Resources because we've traditionally had so many challenges with hiring adequate staff, especially seasonal staff, in order to keep our operations going. And they've been fantastic working with us. We're in this sort of unique space again because we have more than 600 seasonal jobs, and many of them are students. And so we're regularly turning over those jobs, regularly needing to recruit new staff, bring people back on board on all that onboarding process, and really minimize the delays incredibly. And been able to restore pretty much all the services that were lost during the pandemic when we had our shortfalls of staff. And I would say we're even thriving in this department right now, thanks to their help and support and the good work of our team, especially Aaron is kind of our lead on that, on the park side. We've worked really well together. We have our partnership grants and our projects. I mentioned Turtle Woods. We are preparing for either outcome for the millage, focused on the public information efforts for the next 80-some days until Election Day. And we'll be able to pivot regardless of the outcome, determining on how much revenue we'll have in the future. Diversity, equity, inclusion is one of our core values. And just a highlight there that we'd like to point out, this is our third year with the partnership with Huron-Clinton Metro Parks Authority. We're giving free swimming lessons over at Waterford Oaks. 165 kids were enrolled this year, so I think that's probably double our first year. Well, knock on wood, none of these have been in our facilities, but I don't know if you've noticed in the news, we've had our 11th drowning in the county. This year just sort of points to the need to continually work on water safety. And this issue of aquatic safety, water safety, swimming ability is really disproportionately impacts certain communities. African American kids are 3 times more likely to have a fatality from drowning than any other group. In terms of health and wellness, I think this sort of points to the endless demand out there. And many of you are familiar with the Riverwalk program we have at Red Oaks. And every year that fills up immediately when we open up the opportunity to register for it. So there's really an issue of just capacity versus demand there. So we see opportunities to continue to grow and provide more health and wellness programming and opportunities in the county. In terms of natural resources and sustainability, we have taken on 2 Board of Commissioners what began as special projects and have worked their way over to us for responsibility for administration, our native plant distribution. We're going to have another one of those distribution events coming up in a month or 2. I don't know if you remember, Jim. We have the boat washing station that travels around the county to all the public access points for our major lakes. This year, we completed the installation of water bottle filling stations at many of our facilities. Like others, we're dealing with the realities of extreme weather and extreme heat more and more. And so that's part of our plan to adapt and make sure we protect the safety of our guests. And then we have also installed these real-time water quality sensors at our lakes and the county parks. It's interesting. It has, not only sort of just a general benefit, but in some cases there actually is like a real impact to the guests of our parks. We have at Orion Oaks a dog dock. People bring their dogs to swim, and for the last year we've had to close it down due to an E. coli situation there. So it's important that we continually monitor the quality of our surface water. Onto the budgets here. So our department budgets versus actuals. I think what you'll see there is a fairly steady picture. Of course, we're experiencing some revenue growth, both from sales and property tax valuation growth. But we're also facing the inflationary pressures that everybody else is facing as well. They're pushing up costs, increases in wages, et cetera. What we've focused on in the last few years is to try to get as accurate as possible. I'd say we might have had more of an optimistic viewpoint in the past where we hope to achieve with certain sales levels, and now we've taken an approach of overachieving rather than under-delivering. So you'll see hopefully a trend of more accurate budget projections versus actuals as we go into the future. And on the department revenues, I guess one thing I'd like to point out here in FY 20 and 21, we talk about the fiscal health of Oakland County Parks. This is where things got a little bit awry. We're rather than operating surplus to recharge our savings to invest back in our facilities, we had an operating deficit. And so we were using our savings to fund our day-to-day operations, which really then starved off the investment in the assets that then leads to less sales at our facilities. And then you can see how this sort of goes into a death spiral. And so thanks to the action of this board in increasing the amount of millage that was placed on the ballot in 2020, that really allowed us to pull out of that difficult fiscal situation and then begin to invest back in our facilities again.
That millage was in 2020.
2020. Yep. Just in terms of our budget versus actuals, department expenditures. Again, I think you see a fairly steady trend there. Sometimes the issue with our actuals versus amended budgets is the timing of wrapping up capital projects. And then of course our season, when we're still in the thick of the season, when we're still bringing in revenue and have expenses when the budget year ends. So sometimes it's hard to get those two things to match up, but we do the best we can with that. And adopted budget, again, I'm overstated, but we've experienced some inflationary increases. We've also created new positions to deal with a situation of chronic understaffing at our facilities, and people being stretched rather thin. And as many of those are like frontline jobs, like park maintenance, groundskeeper type positions. In being able to, again, with an increased revenue from the millage, has really been very helpful in restoring those positions and helping with the morale overall of the department.
For sure.
And we have taken on a few new roles with the 2020 millage as well, and so we've increased some staffing for that as well. In terms of our fiscal long-term trend, what we're trying to do is avoid the peaks and valleys and try to get to a stable point here where we're able to maintain that operating surplus, putting money back into our net position so that we can invest back in our facilities. I just did the math before we started here, and we have $154 million in capital assets, and it's depreciated down to $66 million. So that sort of points to the age of many of our facilities and the need to just continually put money back into our structures, our land, our equipment. Our staff team, 172. This is a little bit of a quirky situation with Oakland County Parks. We don't fill every job, and so it looks a little bit inflated in terms of the number of positions versus the number that are actually filled. About 172 full or part-time positions, 906 seasonal staff, 192 volunteer positions. I'd say probably about 2/3 of that is what we actually fill on a regular basis. And again, here, you'll see that chart laid out as well. Did you say 7 net positions this year, but some will be eliminated?
It's 2 net positions. We'll have some positions next year that we'll need to delete. We're working on some NR positions that are gonna get converted to full-time with an LOA with the union, the IBW union, and then we'll delete the part-time positions later.
This just give you a little visual presentation of our investment in our facilities. You'll see back in FY18, a little over $2 million. And this last year with the ARPA spending, we had over $10 million capital investment program. So that's not only some of the catch-up from FY20, but the ARPA projects as well, and it really speaks to the staff and their ability to adjust to that kind of a volume increase to be able to move through that many projects. Which brings me to the American Rescue Plan Act projects. This may be a case of be careful what you ask for, you might get it, because we presented to you this $20 million ambitious plan to spend ARPA money, especially invested in urban park revitalization, and you approved it. And then it's been on our corner to get the job done, and it's I hope it's a point of pride for you. It certainly is for us. The scale of what we're doing is sometimes a little mind-boggling. We're, taking over 4 parks from, local municipalities and making sure all of these dollars are spent within the ARPA guidelines, which is required to be all committed this year. So by next month, we'll have all of those dollars fully committed and ready to be spent. During the last few months, we've celebrated a few early wins with ARPA, including the dedication of the Mackerel Playground in Royal Oak Township, the Green Acres Playground in Hazel Park. If you've had a chance to go out to Pontiac Oaks, formerly Hawthorne Park, you'll see the new fishing pier. And then over at Lion Oaks, we have great new pickleball court and playground, and this is just sort of the beginning. Over the next couple of years, we're going to have many more great ribbon cuttings and new things to celebrate in our parks as all of that comes together. And I just always like to point out this as well. There's a lot of times when we talk about these new parks we're bringing in, we get a little focused on the costs, but I think it's important to also point out the incredible assets that we're welcoming into the county park system, really with no acquisition costs. And so I'm a bargain shopper myself. And I think this has been an incredible bargain for Oakland County and Oakland County parks. It's more than 150 acres of urban parkland with forested areas, lakes, the Rouge River. And they're just going to be incredible assets, not only for those communities, but for the surrounding communities and the residents to enjoy well into the future. So I think that's a real win for all of us to celebrate. With our capital grants to communities, in this last year, we budgeted $715,000. We're trying to find that right, sustainable amount of investment every year so that we're not overextending ourselves. So we've trimmed our sails a little bit with our grant spending and $200,000 as well for those local natural resources, community habitat projects. Much of the major trends and challenges I've already touched on throughout the presentation. As I mentioned, we are going to have to adjust more and more to extreme weather and the changing climate. And that means, having the facilities that will protect our guests and our staff, and really provide people with new recreational opportunities. It's on both ends. It's the heat during the summer, and now winter recreation is really not what it used to be due to the lack of precipitation and snow. And of course, the situation in Rochester Hills gave us all reason for pause and concern about the safety of people who come to our parks. And that is something we're building into all of our design and planning in the future. But our major issue really are these unfunded legacy costs that attach to our aging facilities, and really pointing back to the 1970s and 80s when we went on a bit of a spending spree with a focus on acquiring facilities that had the potential of generating revenues, which, unfortunately, more often than not has ended up not generating more revenue. It's generated some subsidization over time, which has then discouraged the investment back in the facilities. And now that they're getting to be 3 and 4 decades old, the costs are rather large to tackle them. And I guess the poster child would be the Red Oaks water park. We spent, I think, $300,000 to $400,000 just on short-term fixes there this year, just so that we could keep it open. In talking with our consultant, we think that'll be about a $10 million project if we want to keep a water park there. And so you've seen the scale of what we spend on an average year on a capital project. That's well beyond our financial means to tackle. So that's something we're gonna await and see what the outcome of the millage is, and then we'll tack from there. Your questions that were submitted. How will the budget allocation support the maintenance and expansion of county parks? I don't want to be redundant with many of the things I've already said. We're catching up on deferred maintenance projects. We're doubling up on capital equipment spending, like chronic staffing issues. I would say overall, we are trying to focus on uses in our parks that are less costly to operate and require less labor to operate. Hard to do that overnight when you have legacy of decisions made in the past. But for the designs and the plans that we're really making for the future, you're going to see a lot more focus on things that are physically sustainable in the long term. Programs and services attract more visitors to parks. We are stepping up our game with recreational programs, special events, updating amenities, and expanding our presence in urban and heavily populated suburban areas. And how do we address long-term sustainability? We do try to focus on not only we have enterprise, but we have enterprises within our enterprise, which are sort of like our golf courses or water parks, et cetera, where we have goals for cost recovery, so that we don't want to subsidize the operations of them because we're sort of playing catch up then, and then we're not able to invest back into the facilities. So we've had a lot of success in the last couple of years with achieving really, I think, probably the best results we've had in the past. 4 out of 5 of our golf courses pay all of their operating expenses and generate a small profit to be reinvested back into them. The remaining one with some issues has a public water supply for the irrigation, which makes it pretty difficult to achieve that profitability.
Which course is that?
Red Oaks, yeah. We've been doing some belt tightening at our campgrounds as well and looking at keeping costs, within some constraints so that we can achieve those goals there as well. Water parks are a bigger challenge, but I would say this year with the record sales at Red Oaks, we're probably going to be as close as we've ever been to covering our costs there. So I think I've probably talked at you enough. Happy to answer any questions.
Okay, thank you. So I'll just say, I was really struck by your pictures of the parks that we've acquired, because it happens to me every time I visit one of the bigger parks, whether it's a metro park or a county park or whatever. I can't help but be grateful for the people 50, 70, 90 years ago who said, we're gonna try and protect this piece of property and make it available to the public. Almost every time I go into a park, I'm grateful for the people who made sure we had a park here. And it's almost spiritual for me that Oakland County wants to make more of that for our population. Because once it's gone, it's gone. These pretty pieces of property turn into subdivisions, right? And so thank you for the work that you're doing to try and figure out how to pay for all this. And I hope the millage passes. I have one question since I'm talking, and then I'll turn it over to everybody else. So if this millage passes and we have the millage from 2020, how does that show up on our tax bills? Is it gonna be Oakland County Parks 2020, Oakland County Parks 2024 millages?
It's a replacement, so it replaces the 2020 millage with a higher rate at a longer duration. So it'll be one issue.
It'll be one, and and you say longer duration, is that 20 years?
Yeah, it's 20 years instead of 10, yeah. That the extended duration gives us a chance to access some of the financing tools that are usually available to governments for larger scale projects.
Okay, thank you. With that, I will turn it over, Commissioner Gershenson for starters.
So I wasn't really gonna say anything because I've already said quite a bit about my feelings of how you've enhanced our parks. But when you said that, Gwen, that it was emotional, during the pictures with the bird, I was really ready to cry because it was so just been so amazing, and the team you've got together, and it is just, our parks are such a great asset. And I don't know if everybody knows that wasn't here, but for the administration before Chris, you know, we knew the parks needed help, and we met on it for like 10 years, and we talked about it, and we couldn't get any action. So you were starting from such a hole, and where you've gotten, and the fact that you realize, okay, now we are there and we still need more. It's really understandable. And I too hope this millage passes. I have total confidence. I think people really value the park, and everything we've been through with COVID, everything has really proven how important our outside life is to our mental health. And we focus so much on mental health, but so I just wanted to again commend you and the team you've built, the team that you work with. You've all done an amazing job.
Thanks.
Anybody else? Commissioner Cavell.
Not to ruin the love in.
There's always one buzz killer in the room.
I prefer enclosed spaces that are private. I hate public spaces.
We'll have something for everybody.
There you go.
We have a basement over at the park.
Perfect, that's what I'm looking for, yeah. No fresh air. No, so you kind of touched on, right, your CIP, your facilities needs. I saw the graph going up and down. Your budget for that, what do you anticipate that to be per year? You said it was 2 million, then it went up to 10 million, now it's down.
I'd say if we could sustain, you know, let's say the millage isn't successful. If we could sustain $4 to $5 million a year, that's a pretty steady reinvestment that we can sustain, but that will require us keeping our operating expenses within, you know, some constraints, otherwise it won't be achievable. We'll eventually draw down our savings.
Okay. And then when you were talking about the golf courses that 4 out of the 5 were able to recover costs, what I would imagine, just as you were here hearing all these other different groups that, you know, raise revenue to help cover some other part of their operations, I mean, is it worthwhile to make golf $10 more a round, this sort of thing, so that it can help cover some other shortfalls elsewhere? And if so, why? If not, why not?
Sure. So we actually had a pretty healthy conversation about the future of Red Oaks Golf Course. It was tied into the ARPA conversation. We did some public engagement on the issue. There were some very passionate people on both sides of it. Shout out to Commissioner Lubes. It was quite a passionate advocate for keeping the course there. One thing it did do is sort of set us up well to increase the fees for the course. So we have done that already. You know, it's really, that course would be profitable except for this issue of the water supply. And one of the things we'd like to spend this millage money on is creating a reuse system, a recycling system where we're using stormwater and a retention pond and, you know, recycling it through rather than, you know, draining off of the Glewa water at Glewa water rates. And we tried to put in a well and using an aquifer will support it.
Okay. Thanks.
Commissioner Rahman or Commissioner Powell, do either of you have questions for Parks?
Sure. Thank you, Madam Chair. Chris, thank you. Great presentation. Just piggybacking a little bit off what Charlie said too, that was kind of what my line of thinking was as well. And I know you've mentioned in the past, you know, golf courses and banquet facilities. I'm glad to see that the overall charges, you know, on what we're generating are great. You know, everything has gone up. Is it sustainable in that space? Whether it's golf, banquet facilities, do you see, I know you mentioned we're subsidizing quite a bit of this for different maintenance. Ongoing, is that something that we should look at reevaluating, or are you pretty happy with where we're at right now in those two areas?
I would say with golf, you know, we were on a 20-year decline that with COVID has absolutely changed the trajectory. And so if you would have asked me that a couple of years ago, I would have said maybe we would be looking at trying to decrease our footprint in that space. But as of right now, it is only seeing pretty phenomenal sustained growth. It would not make sense for us to get out of the golf business right now. The banquet facility issue is probably our most stubborn and difficult one to solve. We, over the years, have tried so many different strategies to recover the costs for those facilities, mostly focused on bringing in an outside catering firm. This year, we've pivoted to, for a couple of facilities where we're operating them ourselves as rental units. Well, we're providing the rental, and then the people that are contracting select their own caterer, make their own arrangements, and that seems to be working pretty well. We've had a healthy rebound in the number of rentals there. We want to follow that model at Glen Oaks. So then we'll be down to just one with a catering contract, and then we'll see how that goes. So something we're always looking at. Difficult because we have the facilities. Some of them are historic buildings too, so that increases the cost to maintain them. Slate roof at Glen Oaks is like $1 million proposition there, and the stucco, it's Beulah Estate. Everybody knows how to do stucco. Let me know. So best answer I can give.
Okay. All right, I appreciate it. No, I think you guys, to echo Commissioner Gershenson, you guys do a great job. As an enterprise fund, it's easy for us, right? The ins and outs sort of all match for our end, which is nice. I know it's not always easy on you, but you do a great job. I noticed too, 17 new positions that you guys have on personnel, but you're really net neutral. It's only costing us, I think, really 3 out of those 17, which is phenomenal too. So, just kudos to you on that. And then one quick comment I had, which is a drop in the bucket compared to the budget and everything else we're talking about. Credit card fees, I know, went up just, a nominal $40,000. It's not a huge amount. But was any discussion or consideration ever made to maybe pass on credit card fees? Is that something worth considering at some point?
It is an option with our credit card vendors. We have historically built it into our pricing models that we charge to the customers. We found with other agencies that do that, they get a lot of pushback of folks getting add-on fees for everything that they're doing. You see it probably in your life when you go out to car dealerships with paperwork fees and things like that. So we're absorbing those costs in the rates that we're publishing.
I don't think we want to discourage credit card transactions either, because it's sort of a labor saving.
Yeah, it's actually, credit cards are cheaper to process versus your shrinkage with theft,
Cash.
internal theft, cash handling, transportation to the bank, et cetera, so.
Okay. All right. Yeah, I agree with you. I feel like everywhere we go these days, there was just a vendor the other day I was dealing with, paid with credit card for my whole life, and now all of a sudden there's an extra 3% fee. But their explanation is, everything is going up, costs are going up, and we have to pass that on to you. So it's just a thought, but.
All right. Thanks, Commissioner Rahman. Anything else?
Thank you. Nope, I'm good. Thank you.
Hey, Commissioner Charles, did you?
What was our close of this? I just want to make sure I'm still.
This ends at 3:30, this group.
Okay, so nothing but accolades, of course. And the reason is because I get the pleasure of serving on the executive committee with Parks. I'm a Parks commissioner, so I do feel super ingrained. So all of the things you're saying in terms of shining lights on Chris and the staff, us old board members, Parks Commission members, and executive committee members, take that thanks and gratitude as well, because Chris comes to us and he's very great at communicating the pros, the cons. Everybody who knows me knows I'm a SWOT analysis type of person. I want to know what the threats, the weaknesses are. And, just at every turn, Chris and the staff seem to be ahead of the game. And I just really appreciate that. I know. I wanted to make sure to invite commissioners to, peek into a meeting of the commissioners of the Parks Commission. It's listed on our website, and you get to hear from some of the other commissioners on that board who come from all parts of the county and have great insights as well. So I figured I'd take a little bit of time just to highlight that we we're really excited about what we're doing, and we're going to be in the right legal way encouraging people to support this millage coming up. And that includes my colleagues across the aisle in their own communities where there is a great amount of beautiful parks that need investing and maintaining. And so now's not the time to hold back on that support. So I will be working diligently in Rose and Springfield and Independence, all of the beautiful parks we have, to make sure that we can pull this thing across the finish line. That's all I wanted to say, Chair.
Thank you. Any of the other commissioners? Seeing nobody else with any comments or questions, I want to thank you all for coming today, and great presentation. We love those parks. I've been at banquets at White Lake Oaks, Glen Oaks, Addison Oaks, and Lion Oaks. I've been at a banquet at each one of those, so. And I got married, my wedding reception was at White Lake Oaks.
Okay.
400 years ago.
Thank you.
We gotta get you the twin chimneys.
Yeah.
So we gotta get you the twin chimneys.
Isn't that, we're the twin chimneys up at
Independence, right?
Independence, right? We
Yeah.
were there, we took that bus ride.
Oh, that's right.
Yeah.
So beautiful.
That was fun. Okay, so I will bang the gavel to let him welcome to the Treasurer's Department and the Treasurer. You're our last group today.
Okay.
For the commission, it's page 31 in the categorical and 156 in the big book. And if you would introduce yourselves and then you can walk us through your presentation and then we'll have questions of that.
Sure, that works. Well, good afternoon, everyone. Nice to see you all again. Thank you for having us. Joining me today, who I think we had last year as well, Jody Weissel-Defoe, our Chief Deputy in our office, and Jill Robinson, who is a property specialist, the property specialist, capital T-H-E, the property specialist, but also the Chair of our Land Bank Authority. I'm sorry, the Executive Director of our Land Bank Authority. And I can't look backwards, so I'm gonna look here. So are we also putting them forward? Do you need us to do it or is
Yeah, you have the clicker
right here? Okay. Fine, thank you.
There we go.
There we are.
That's us.
Yes.
There we are.
Slightly
Well,
different
that
hair,
was-
but that's us.
Yeah, that was, my kids were a little younger and I feel like I was sleeping better then than I am now, so.
Wow.
Probably have more wrinkles now. All right, so today we're presenting the Treasurer's Office budget for fiscal years 25 through 27. This general fund continuation budget of $9.5 million provides the necessary resources for our office to deliver statutorily required and services and absorbs the current costs of the Oakland County Land Bank Authority. We believe our residents deserve access to the highest quality of service from our team. One of the things that we will mention is we continue to monitor our tax collection rates. There was a 12.2% increase in delinquent taxes turned over to our office this year. Last year it was $67.85 million for 2022 taxes, and then this year it was $76.1 million for 2023 taxes. But we always talk about how delinquent taxes being turned over to our office is a lagging indicator, so it could continue to go up. And we just kind of monitor and see. Next slide.
Do we have any idea why?
I mean, I think inflation, right? We saw a property tax increase. A lot of our folks get delinquent and unfortunately stay delinquent, right? And then there's also, just everybody's costs have gone up, so some people have struggled with paying their taxes. And then the tax amount is just higher, right? The taxable value across the county is just higher.
Right. Yeah, because it's the lesser of inflation or 5%, and it was going up 5% for some time and hadn't for so many years, right? So that makes a difference. So, and we talked about previously how there were safety nets put in at the federal government, right? The MyHalf program, like CARES Act dollars, those kind of things that are no longer there, and we'll mention that a little bit in here as well. So I think that's part of it. Our duties include collection of delinquent real and personal property taxes, and we do that on behalf of all 63 CVTs. I'm sure you all know this, but we have more CVTs than any other county in the state, our cities, villages, and townships. Receiving and dispersing county funds to meet the county's cash flow requirements. Investing of surplus funds in accordance with the investment policy that we have that you all signed off on. Also following Public Act 20. Which kind of dictates what we can invest in. Administering our local government investment pool, so investing on behalf of some of the local governments here that have us invest their money. And then also, by virtue of this office, serving as the treasurer for the county's building, arts, zoo, public transit authorities, the Economic Development Corporation, the Business Finance Corporation, and the retirement system. Also managing the debt portfolio and supporting the retention of our AAA bond rating, which we like to hang our hat on, as well as the Oakland County Land Bank Authority. We've completed our settlement and distribution to help cash flow our local communities. I think I talked to you all about this last year as well. And then we also continue to administer the delinquent tax collection process, which funds our delinquent tax revolving fund, the DTRF fund that you are probably familiar with. Next slide. Our office remains steadfast in our commitment to fulfill our statutory responsibilities and to assist Oakland County families and businesses to avoid tax foreclosure. As you can see on here, we work tirelessly to try to prevent foreclosure, and I've spoken to some of you about that in the past and came to caucus meetings to talk about that. You look at the numbers as it goes through, the amount of parcels that turned over delinquent taxes, and then properties that paid in full, and then our work when we do our one-on-one taxpayer assistance meetings, we call them TAMs. So they're one-on-one confidential meetings that we work with people based on their unique situation to try to help prevent foreclosure for them. Getting people into repayment agreements. So we, try to find something that is kind of a win-win. We, obviously, our job is to collect the taxes, but something that works with them to try to repay their taxes in a timely fashion. So all the work that we do, and then at the bottom here, you see that it listed my half as well. That was what I alluded to earlier. 7.4 million came to Oakland County taxpayers through that My Half program. So that was federal dollars for COVID relief. That went to Oakland County taxpayers specifically. And then this year, we are at, I think it actually even went down from that, but about 130 properties that are at auction on Friday. Friday is actually our online auction. So just FYI. So that's kind of the work we're doing. Let me. Fly going by here. Also within our office, we have our Financial Empowerment Center, and Rita, who runs that department, and like a financial coach. We do, as you see with all the work that we're trying to do, trying to prevent foreclosure, because foreclosure not just impacts the person or the family, but it impacts their neighbors and impacts the entire community. And so we're doing everything we can to try to work with them. So we'll go on to the next slide. So this one, I'll kind of talk you through because there's nothing up there, but the Raffaelli settlement, which you're all familiar with. So I don't have to go to kind of the history of that, but our legal team has finalized all the settlements for those who opted out of the class action. We closed that class. But last month, the Supreme Court ruled that Raffaelli was retroactive, and the statutory claims process that is now in effect is also retroactive. But we were insulated from that because we settled, right? We were very proactive. The only outstanding claims that we have here are related to the property that was purchased through right of first refusal. So that's the process where if it doesn't go to auction, prior to it going to auction, the local communities could take the property at right of first refusal, and all they have to pay is, previously all they had to pay was the delinquent taxes, interest, fees, and then it was theirs, right? So there was no surplus if you looked at it like that. So we are actually still reviewing kind of the order and still in negotiation with those cases that were through first right of refusal, if that makes sense.
And actively, literally, I just got off the phone with our attorney before we came here. They were in court this morning with those cases. So this is an active negotiation.
How many cases are there?
I think there's about 12 they're all located in the city of Southfield.
Okay.
And they're divided between 2 or 3 cases. It's 2 or 3 cases, depending, I think, on how you look at it. So, but there's multiple properties within each case.
And is that because Southfield treated them differently than other municipalities?
Southfield took them, well, careful what we say, but ultimately, there weren't a lot of communities that exercised the right of first refusal. It actually, there were a few that did, right? Southfield was one of them, Hazel Park was one of them, Oak Park, Madison Heights. That exercised their right. I think one of the things we've seen with Southfield is some of the ones that they took were actually occupied at the time.
Oh.
Whereas I think in every other community they were not occupied. And I think that's where the lawsuit stemmed from.
Okay.
So
gotcha.
That makes sense.
Yep.
Makes very much sense.
So, but moving forward, that law has changed, right? So I was actually in the legislature when we voted to amend the law. Giving people the opportunity to collect their surplus. So we also changed within our office the right of first refusal process. So now if a local community wants to exercise the right of first refusal, we charge them twice SEV, which is market value, or we do an appraisal. There's certain requirements that we have implemented based on those that we do an appraisal. So it's one of those two numbers, so that, again, if someone does file a claim, there is surplus for them to get. For the 2022 tax foreclosure auction, we received 28 claims filed on there were 374 properties that went to auction that year. So 28 claims. And if you remember, that was after 2 years of a moratorium on foreclosure. So 374 actually wasn't that high if you consider those are like 3 years of foreclosure numbers. And then the circuit court ordered 15 payments on those. For 2023, we've received 12 claims on 95 foreclosed properties, and then the circuit court ordered payment on 9 claims, and those have all been paid. As soon as the court orders us, we make that payment. We'll go to the next slide. I think we'll start on fiscal services slides, right? So this one, I guess, they can answer any questions, I guess, that they're here in the room as well, but I think it's slightly misleading. Just do the 10 million accounting entry that was requested by the auditor, that was posted after the Raffaele decision, that was entered, and then it was reversed. So that's kind of why you see that number going up and down like that, or the graph, I should say, the line. So we go to the next slide. So we're here. So is it big enough for you to see? Yeah, I guess it is. So property taxes, bigger up, easier up there, but the property taxes, so this is for the payment in lieu of taxes, swampland, DNR land, things like that. The charges for services, the administration of that LGIP I was talking about, the local government investment pool, accounting fees for the authorities, tax foreclosure process fees like title search, posting the properties, maintenance of the properties, things like that. Fiscal year 20 and 21 had old tax foreclosure, that was under the old tax foreclosure surplus law, where our office budgeted for 1 million of surplus. And then for other revenues, it's interest and annual transfer from the DTRF. That's listed here as well. I think that's it on this one. So again, the Raffaele decision, which we're glad to put this in the past, but it's still obviously there behind us. But the liability was created after the Raffaele decision in 20. If you see in 21, we were under budget. And then 22, the money was dispersed for the Raffaele decision, so those funds went out. And then in 23, we were back down under budget. So those things that we were proud to say. We go to the next slide. So personnel is like staff and fringe benefits, obviously you all know that. Operating expenses, so these are our foreclosure notifications, title search, recording fees to the Register of Deeds, property maintenance, and posting of properties. Internal support, building space allocation, IT, insurance, telephones, things like that. And then the other is demolition paid through facilities as a transfer out. Next slide is our personnel. And you can see, over the years, we run a lean office. I'll say that first. And we have been trying to fill and filling some of those positions, but we've had some retirements, and unfortunately we lost an employee as well. So we are almost at full capacity in our office. We have a few that we're going out trying to hire now, but like I said, I think we're pretty good about being very lean in our office and the work that we do. And let me see what's next. Land Bank Authority. Great, happy to talk about that, and Jill is here as well. So we know that it's been around, just about a year and a half or so. And there's some key achievements that we do want to highlight. And this is money that has come to Oakland County because of the land bank, because we started the land bank. And we've had over 1.3 million funding, blight elimination funding that came, again, from the federal dollars to the state that we got from the state land bank. 200,000 was round one. We stabilized 2 historic houses in the GM Modern Housing neighborhood in Pontiac. $500,000 on round 3, the McCarroll School demolition. We were just there the other day for a press conference. They're creating a youth recreation center there. So we helped with that. And then round 4, Emerson School demolition, to create a blank slate for future planned housing project in Pontiac as well. Obviously, this is very, heavily Pontiac at this point, but there are projects that, and Jill can answer any questions if anyone has, but there are projects and talks throughout the county and some other opportunities that the land bank will be working on as well. And again, with in Pontiac 111 Oneida, this is a labor of love. This is a project that's been on Jill's plate for a long time. And partnering also with the Housing Trust Fund on this one as well. And this is a beautiful old building that we're all gonna celebrate when it's done. So a lot of love and time and energy that Jill's put into it.
I don't know if Jill has anything to add.
Stole my thunder.
So
I have a little bit, but are you done?
yeah, sure.
Okay, I wanted to, the grants we've received have been through a competitive process, so that's been an interesting grant writing opportunity. So we've had to really make sure that we have important projects that make a difference in our community. The demolition of McCarroll School, I think that's a highly anticipated project for the city of Pontiac with the recreation center. They passed a millage, I think 7 years ago, for funding for personnel and programming for youth recreation that they didn't have a building for. So this will help them have a building where families and kids and individuals can come for classes and community and all of that kind of stuff. And then the Emerson School demolition, we have a housing crisis. So anything we can do to help facilitate more housing that is safe and affordable, we're on board. So this one is owned by Micah 6, who are the ones doing the Webster School renovation. The plan for this is to create a small footprint housing community. So it'll have community green space. It will be a community land trust, which is an interesting concept that the nonprofit owns the land. People buy the houses, so it controls affordability because the land cost never goes up, never fluctuates. So people purchase the homes, they lease the land. It's typically a very long-term lease that's renewable. And then the homeowners agree to sell the house for a restricted price, and then they can benefit from some of the appreciation. It's all in agreement with the Community Land Trust, and they're working towards that. I think they want to finish Webster first and then kind of start that one when they're done with that. And then 111 Oneida, I think one important thing about that one is the importance of making sure that where I come from, we know our developers. We foreclosed on this property in 2014, kind of the week I got to the county. And I've been working for 10 years to find a developer that is responsible, that loves the property and loves the city. And the couple that is doing it, Renita and Greg Coleman, they have a history in Pontiac. They're amazing people. I've learned so much about tenacity and how you get things done. And also the collaboration that we've had to work through with the Housing Trust Fund, MISHDA, MEDC, different funders. It's wild to just watch how all these people, kind of work in silos and how you really have to have meeting after meeting to come to an understanding that state programs have different timelines, but they need to work together. So I think we've been able to get over a couple of bumps in the road with all of us. So that one will be missing middle housing. It's 60 to 120% AMI, which is roughly 36,000 to 72,000 for 2 people. So definitely right in the middle of the median income. And that one obviously was with the Housing Trust Fund, MISHDA Missing Middle, MEDC, and IFF, which is CDFI, which is a community development financial institution that is really started to come into Pontiac and work on affordable housing solutions and kind of get to know the community and the developers. So I'm excited to keep working with them. One other thing that we're going to be doing in the next couple weeks is the state land bank owns properties in Oakland County. And the agreement was we would eventually take them. There's about 100 of them. We'd take them when we were ready. And we're ready. So we're getting ready to get those transferred over to us. And the beauty of that is a lot of the properties they own are adjacent to either ones we own already or the city of Pontiac owns. So I'm working with the city of Pontiac to do a RFQ, a request for qualifications of developers. We'll have a pool of developers that are capable of doing multiple developments at the same time, housing developments, and then we'll issue RFPs. So we can find adjacent properties, maybe there's 20 on a block or 20 within a few blocks, and issue that proposal and say, can you do this type of house? How can you do it? What's your cost? So I think getting that kind of into a flow with the city of Pontiac, collaborating with them, and hopefully with MSHDA and MEDC, we'll be able to see some new housing in the city. And then just our partners, I think lessons learned so far is that, connecting to people, even though you think that they might not be able to help or may not be able to help them, you never know who you're gonna know, right? It's been really interesting to talk to the MEDC, who is directly connected with the Michigan Strategic Fund. One of the projects we've been working on is one in downtown Pontiac. So the county's at the south end of the loop. This project is at the north end of the loop. I think some of you were on the tour when we were talking about different ideas for around the Oakland Press Building. That is moving forward. They were invited to the Michigan Strategic Fund for their transformational brownfield project. And that will be about 300 housing units, commercial space, the Oakland Press Building. They're looking at a few different uses for that. They also acquired the property, the old Waterman Building on Saginaw, and then the parking lots between those two buildings. So they're looking at, I think they said December, they're hoping to close on all of that with the strategic fund. So all in all, it's been an exciting couple of years. Lots of residential developers, lots of commercial developers, talking to folks in Farmington, talking to people in Southfield. There's a project called Middle Point that we've been talking about a lot, seeing how we can help them. And it's just about connecting with, Kyle Hines and the Housing Trust Fund, Brad Hansen with the Brownfield Authority, and the economic development staff. I think together we all work really well together, and hopefully we'll be able to see some of this long-term development start to take hold. Development is not fast. I remember a couple people previously in our office thought development happened in 12 months. Sometimes it takes 10 years. So that is, I think, it for now.
What about our board announcement? They may or may not.
Oh, we had Jeff Campbell, who was the manager in Beverly Hills. He had to step down from our board. He left Beverly Hills, so we'll have an opening. We have an opening for a township representative that has experience in economic development, planning, real estate, those types of things. So if you know anyone or you hear anyone interested, I think that will be announced probably in the next couple of months.
I mean, it's not up to the board on their whenever they open the position.
Right.
Yeah.
And I think board staff has the resignation letter, so they'll, I'm sure, let you know. I think that's it.
Thanks, Jill. And then just a couple things, and then I think we're good and answer any questions you have or anything you want to add. One, last year we talked about, we had an RFP for our banking partner, and we have completed that. We are continuing our relationship with Huntington and with Flagstar, and then kind of our main bank, we switched from PNC to Chase Bank. JP Morgan, and then our team is meeting with the impacted departments as we work through the transition to share kind of the new offerings and opportunities that Chase presents for efficiencies and fraud protection. So that's ongoing. That's a lot. It's a heavy lift. That's why we do it every 5 years at most. Excited to give you also advance notice. We're actually doing a press release, I think, later this week that we're partnering with. They're actually one of Michigan's largest. They're one of the largest banks headquartered in Michigan, independent bank, and we're doing a pilot program, doing a down payment assistance program with them. So we created a fund of $100,000 to provide $5,000 grants for first-time home buyers in Oakland County. And so they'll apply through independent bank directly. I think we have flyers.
I did not bring them.
We'll get you flyers. Yes, we have them in our office. They are done, but it's a really exciting opportunity to help hopefully new residents here in Oakland County or those that were renting and looking to buy here in Oakland County So we're excited to announce that as well and hope that it is a success and we'll expand on it. So I think that's it. I appreciate the opportunity to present to all of you and giving us the opportunity to talk about the work that we're doing in the treasurer's office. You know, we have a great team. I'm proud to work with all the people in our office. You know, I'm glad to say that we operate within our budget, that we're not asking for anything additional this year, that the interest that we earned was above what we budgeted. So all in all, things are going well in the treasurer's office. So I'll turn it back over to you and answer any questions that you might have.
Okay, well, thank you. We like it that the treasurer's office is running well. That would be a problem. And I just wanna say I love 111 in Maiden. I've probably told you that before, but I had family that lived there back in the 40s and 50s and probably 30s. It's just such a cool place. I'm so glad that we're gonna make it good again. Okay, with that, I will open it up to the commission. If anybody has any questions? Commissioner Cavell, I was counting on you.
Gotta make it feel like it was worth your while.
We're good.
So a couple of questions. There was a slide that says there were 244 properties foreclosed and 109 withheld. I don't know what those terms mean, what the difference is. Yeah, that one, yeah. I don't know if the with, like,
There's a variety of reasons that we withhold property before it goes to sale. Some, it can be we found a service issue, right, that maybe every interested party wasn't notified. It could be that they were on a repayment schedule. There's a variety of reasons that we
withheld
withhold.
means it didn't go to auction.
Correct.
Gotcha.
The bottom
Got it.
number, the 131, is what's going to auction this week.
But, so then just to know, the 244 properties were foreclosed?
No.
Yeah, I'm sorry. That number does mean that that is the judgment of foreclosure that the judge signed.
Got it.
There were 244 properties on that in March when the judge signed it. And then 109 were withheld after the judge signed it for usually service issues. Sometimes there's other reasons, and then that gets us to the 131.
Okay, so then, and of those 244, do you have like a guesstimate of, I know last year I remember some of these were just properties, some of them were
Vacant
homes.
land, yeah, most of it is vacant land. Yeah.
Okay.
I mean, there's some homes in there, not much commercial this year. Maybe 2 commercial properties. Vacant gas station in Pontiac is
Okay.
one of the commercial properties.
Got it.
But yeah, it's mostly vacant land.
Okay, cause the MyHave program you said wound down.
It's done, yeah. They extinguished all the funds.
That program was awesome and lasted like 3 years, was it? 2 or was it?
Probably about 2.5
Yeah.
years, yeah.
Okay.
Cause Step Forward existed for about 5 years in 2013 to 2019, 6 years. And then that ran out of money, and then MyHave came back kind of as a Step Forward 2.0, similar program, but with different federal funding.
Is there any, I'm just gonna throw this out here and just say to all of us, right, that I mean, when you did your presentation last year, the MyHave program, I mean, I think you said it in this one, but I don't have the slide.
Yeah, 7.4 million.
Right, 7.4 million, but it was also like several hundred families.
755.
So 755 families avoided losing their single biggest asset and literally becoming homeless. I mean, is there any interest or ability for conversation about an Oakland County MyHave? Perhaps drawing from the DTRF, even if it is just a portion of the size of that. I mean, is that something we could all talk about or think about, just because it was so impactful?
Yeah.
It feels like it's the light lift.
Yeah, I mean, that is absolutely something we'd love to
It's cool,
to talk about.
Okay.
Sure. Yeah, that's something I've talked about prior to MyHave being around, and because of Step Forward no longer around, we talked about if there was something we could do like that in Oakland County, then we put that on the back burner because there was MyHave.
Right.
So now that MyHave is no longer around,
Yeah.
I think it's a discussion worth having.
Could the money come from the DTRF? I know we have the fund policy of 200 million, like minimum, but it's been out 206, 209, 215, so like, Is
I
that
mean,
a
there,
reasonable place
there's
to
a whole
draw from?
statute around what the DTRF could be used for, so I think we need to look at the statute to see if that's an allowable expense. I mean, the delinquent taxes that come over, because we cash flow them to the locals, when that money comes back in, when taxpayers are paying their bills, it's paid to the DTRF.
Yeah.
Right, so I think we just need to make sure if we can get legal clearance on that.
Okay, but that could be a potential source. That's already.
We won't say no.
Okay.
We'll see.
Yeah.
Yeah, and then that DTR, right, so the fund itself is there to cash flow the local communities.
Yeah.
Right, and then the money that we collect goes back into it, right, the interest and the fees and everything.
Right, and I know the statute explicitly allows for capital improvement cost as
Okay.
well, or like debt service on capital improvement. we need to look at, see if there's any gray area that would allow us to create a fund like this.
Okay. I guess one thing, not to out anybody or whatever, but did this come up in your guys' talks about
No,
OCA?
we did not make an
Okay.
ask.
Okay, cool.
It's all yours, Charlie.
We're a team though, you know? Okay, and then the question becomes too, last question, so how many people were foreclosed in 2023 versus the 244 this year?
Well, I don't think, so
properties, I guess.
the 244 is not, I mean, we look at it mostly as what goes to auction.
Sorry,
is
yeah.
what foreclosed, right? Because we withhold as we do file review, so that 244.
We cancel the foreclosure.
We cancel the
It's been
foreclosure,
recorded.
right? They still owe their tax unless they paid it, right, during that time once we unforeclose them, but technically they'll probably still owe their taxes, but the number that goes to sale is the number to look at, because
Okay.
that's how many the treasurer still owns,
Okay,
right, and that we can sell.
okay.
We remove them from foreclosure if there's a servicing issue, whatever the issue might be, right? We have to go through file review to make sure that we follow every single, that follow the law, right?
Cool.
Exactly. The year before, we had, I actually don't remember it offhand.
97, yeah, I know, I feel like it's 97, yeah.
It was under 100, but it was, yeah.
Right, and it is right here, it's in your notes because it's in the claims.
But it was zero families,
95.
and it was
Yeah.
zero homes or families, right? Like zero occupied residents, it was awesome.
It was low, I don't know if it was
Well,
zero.
but again,
it was
we withheld
PREs.
PREs because of the MyHF program.
Sweet.
Because we wanted people to
So-
apply to the program, that's what you're
Okay.
remembering.
Didn't mean it wasn't occupied though,
Right, it could've been
because
a
it could have been a rental, right? But principal, if there was their principal residence, we withheld automatically all principal residents, all PREs, because of the MyHap program, to give them time to apply for the MyHap program. So we did that for 2 years, for
Awesome,
22 and 23,
awesome.
so.
Which again, 755 families avoided foreclosure with.
Correct.
Yeah, because you
And
had to be
paid-
PRE to get MyHF, yep.
Yeah.
Correct.
Mhm.
And which paid up to $25,000, so some of them,
Sure.
the hope is that they are no longer delinquent and now they're able to, moving forward, pay their local community the taxes. So-
Understood. Okay, thank you.
Sure.
Okay, Commissioner Long.
So just, thank you, on, Commissioner Caval's question, on the 131 properties on going to auction Friday, are most or all of them in Pontiac? Or
No,
are
they're
they
across,
all over?
we have a large
Weren't they
gravel
all-
pit
a
in
lot of them
Commerce,
weren't-
for example.
Oh, that gravel pit, yeah.
Yeah.
The
So we-
gravel pit.
Come on,
That's on
Chris.
there? Okay, I need a gravel pit. What would I do with that?
Yeah, so two very large parcels in Commerce.
Okay.
Royal Oak.
There's
What
a
do we
Royal
do?
Oak
Is that on your site, your treasurer's
It
site?
is, yep, it's
I
linked
mean,
on
I'm
our
just
website.
curious to see what's for sale.
You can
Absolutely,
go.
yep, it's
It's-
at tax-sale.info
Okay,
is the auction site.
all right, thank you.
And this company does auction for 72 other counties and DNR for the state. So they have properties all across the state that they auction, and then that was part of us moving over to them 2 years ago, is because they are able to do this and it actually doesn't cost us any money. It saves us money actually, because it used to cost our office time and
I remember
energy
you saying that.
and rental fee, all these things. And this, they charge a percentage to the buyer. So this actually saved our office in the county money.
Yeah, a lot of
So that was a
effort
good
as
move
well,
by
a lot of
you guys,
staffing
right?
as well.
Yeah, thank you.
Yep.
Good, thanks.
Okay. I saw Commissioner Smith Charles.
Thank you. I'll start with the last part because it just came up when you said passed on to the buyer. You know, the buyer is getting a lot of things passed on to them right now. Just as a FYI, might be sensitive to that. Also, as I've stated many times, my half might have worked for 755 families, but I know personally that there are a lot of families that are not help by my half, because as with most things, it seems like they want you to be completely underwater before you get a lifeline. So my half was like the 3-year, the people who were past the lien phase and were in an actual foreclosure phase. So if you called them at the 2-year, they, well, at least with Step Forward, I think it was called before that.
That was different, yeah.
You had to be already in the foreclosure process to get help, which just seems so backwards. My half, again, as we look at what we can do here, I really want to encourage us to look for ways to help those people who are at the 2-year phase. Because again, you know, it affects your credit and just, you know, your ability to buy and spend and do things. I feel like we would help more people and get them back on track if we thought about that 2-year versus the 3-year.
And can I just, Commissioner, because I just don't want anything,
Yeah,
we
please,
do not
correct.
report to credit agencies. So tax foreclosure, delinquent taxes does not report to any credit agency. So that, from a credit perspective, I just want to be very clear.
I'm glad.
We do not do that.
And then when we talk about foreclosure, and this is something I think I'll have to ask when the sheriff comes, but we've got 2 types of auctions happening. Your auction is just once a year.
Correct.
Correct. And
Well,
then,
there's multiple auctions, they cascade down. There's one foreclosure a year, all the properties go to auction this week. Anything that doesn't sell goes to subsequent auctions.
oh, okay.
So, yeah.
Excellent. And so when it comes.
Sheriff's auctions are monthly.
Weekly.
Weekly?
Yeah, they're kind of like
Weekly.
weekly, yeah. So I just wanted to make sure that there was a distinction, because sometimes when we hear about foreclosure, we automatically think it's you guys, when it could just be their mortgage company.
And and more often than not, it's that, right? I mean, you hear, the mortgage foreclosure, and we get calls all the time because people talk about foreclosure, and we're like, there's a difference between a mortgage foreclosure and a tax foreclosure. Mortgage foreclosure is with a private company, right? It's a contract with a private company. Theirs is, and it's kind of the reverse. Theirs is very front loaded, right? So they can foreclose in a kind of much quicker than we can, and you know, with tax. And then you have time to redeem at the end. Ours, it takes longer to get to the foreclosure, but once you're foreclosed, there's no time to redeem.
Oh, I didn't know that.
That makes sense.
No redemption.
Right.
Excellent. All right, and then that URL was tax-sale. What was the last?
Tax-sale.info.
I wrote
So
on
not
there.
the easiest
Dash or
site.
hyphen, yeah.
Dash or hyphen, I always say dash.
Okay, perfect. Thank you, Madam Chair.
Okay.
And it's not that, we can make,
Anybody else?
we can develop.
Commissioner Rahman, did you have any questions?
We can make it a good question.
No, guys, great presentation as you did last year as well. So thank you for that. I'm going to stretch a little bit. What do you see as your biggest challenge or obstacle? I know things are going swimmingly and lots of great victories here. Could you identify maybe a greatest challenge at this point?
Well, you know, for us, again, like we, as government entity, as public service trying to help, you know, I always see the issue is the people in the community and trying to help them in foreclosure. You know, most of the time and energy and effort that we have in our office is spent on foreclosure prevention. And so what can we do to every year try to lower those numbers and keep them low? And I would say that's kind of the one thing, is figuring out how to allocate our resources and our time, what we can do to try to prevent foreclosure. So that, I would say, is probably number one. You know, we do really a robust outreach campaign, but can we do better, right? I try to go speak personally to as many city council and township board meetings to let people know. You know, we do kind of a multimedia campaign, and then obviously per the statute, we send all the notices. I think there's 10 notices or so that go out, and we also added
Interesting you say that, because statute only requires like 2 notices a year, but through our new relationship with Title Check, who is the auction company, they send so many additional notices that we think led to this, you know, also helped us get to this 131 foreclosure. Before every step in the process, they send a notice and they say, hey, do you not want us to post your house? Pay by this date. Do you not want to appear in the newspaper? Pay by this date. Do you, not want to, whatever the next step is, they kind of send a pre-notice to that to give people an opportunity to encourage them to pay to prevent an action from happening.
So I think that's, Commissioner Rahman, I think that's always our challenge, right, in our office to talk about that.
Sure.
And just always providing the best service we can to people as they come in, because you know, when people owe taxes, they aren't always super happy to come see us.
Right.
But at the end of the day, you know, we wanna be helpful to them, and that's something we make sure that our team, anyone that's interacting with residents as they're coming in, that we're compassionate with them and trying to work with them.
Makes sense, makes sense. And completely switching gears to a question, really has nothing to do with your office per se, but with credit cards, I was just asking the Parks Department, you know, do they charge or do they pass on credit card fees? I presume that we take payment through the treasurer's office via credit card. Is that fair to say? Is there a fee if residents choose to make their payments through credit card, and how does that work through your department?
Yes, there's a built-in fee. We
So
have a
we
fee
work-
structure.
Yeah, so we work with G2G, which is the county's credit card program, and we pass the fee along to anyone who chooses to use a credit card. I can say I have been on for about the last 6 or 9 months an RFP process for a new merchant service, and so obviously the fee structure and whether we absorb the fee or pass the fee along is part of our conversations now as we are moving to vendor selection.
Good. I see. Do you offhand know what our fee is off the top of your head?
It's a sliding scale based on how much they're paying.
Yeah.
So like it maxes out at 3.75%. Yeah. So I think if it's over 1,500, 1,000 over 1,000, it's like 3.75%. Under that, it's a sliding scale.
Got it. But we're looking to potentially do away with that. Am I understanding that correctly? Potentially doing away with that if we
It's being reviewed. It's being reviewed, and I think certainly the scale is being reviewed as part of this vendor selection, because obviously a new vendor is gonna have different fees.
Right. Sure. Makes sense. Okay. Perfect. Thank you. Thank you, Madam Chair.
Okay.
I wanted to picture the budget.
Commissioner Wiper.
I see this as big, not big change, but fewer photostats and fewer FOIA charges and things like that. Was a lot of that found Raffaelli? I mean,
There definitely was a lot of FOIAs around Raffaelli,
Right.
absolutely. So, yeah, and I mean, we also, there's a abstract statute that allows us to charge a per parcel fee. Zillow has been challenging that in the legislature and with a lot of the county treasurers. So that kind of fee structure has changed a bit of what we charge when people, I mean, we get FOIAs multiple times a week that just give me your list of delinquent taxpayers. And it's really sad because folks harass our people, right? And so we constantly call us, we'll tell you if it's a legit notice, we'll tell you, if you, need to hire, I mean, unfortunately, we have attorneys that do this and, make claims that we won't help them and that we're gonna take their property, and only through an attorney can they prevent that. And I mean, I think our biggest, kind of exactly to what Robert was saying with like our compassionate service, we want people to know that we're available, you can call us, we're here to help and talk you through this process. You don't need to hire a lawyer to talk to our office.
thanks.
Is that it, Commissioner? Okay, anybody else?
No, thank you. That's good.
If not, then thank you very much to the treasurer's office. Very enlightening. I made a bunch of notes.
Appreciate it. And when,
Good. We're happy.
reach out to us anytime if you have questions or need anything, we're always happy
You
to
know
help.
where to find you.
You know where to find, we're not very far from you.
Not very
yeah.
far,
I
alright.
can see you.
Yes.
Yeah.
You can see some of our staff feeding the cranes when they shouldn't be. But I think we told them not to anymore.
Oh, is that why the cranes come around here? Is because we've been feeding them?
I think so.
I think so.
I won't admit to that, but yes, there are signs now.
He's like, I know
There's
this is
definitely, I mean,
recorded.
there are signs there that say not to feed the cranes, and we make sure that everyone
I know,
knows
so
that.
they do get.
Jody hasn't said a word. We're very compassionate people in our office.
Jody's car is always the first one in the parking lot. She loves birds, I also heard.
Yeah, she comes before anyone sees it now.
Did you name them Fraser and Niall? Just figured I'd drop that one in.
Oh, yeah.
All right, before we go,
Thank you.
we still have public comment.
Oh.
Is there anybody from the public who cares to address this committee at this time? Nah, we don't want no more.
We gotta find out and see if you get
Alright, so seeing no one for public comment, is there any other business?
Oh.
Stick around because Mike's gonna tell us what time we have to be here tomorrow. So I will call this meeting adjourned.
Good.
Thank you, Madam